Hello, my dear friends. Today I have a wonderful guest, an expert with great experience, 25 years a professor, Doctor of Medical Sciences, Honored Doctor of the Russian Federation, head of the center.
I immediately fixed the badge.
The director of the medical center, Bazunov Roman Vyacheslavovich.
Hello.
It's a pleasure to welcome you. It was very difficult to invite you here, and I'm very glad that you agreed. There are a huge number of questions, and if on many related topics, for example, endocrinology, urology, andrology, I usually know the answers when I ask an expert, but today I'm really interested myself. Because you know how much sleep suffers for surgeons, especially when they work in emergency surgery. And I'm really interested in how important it is in general and how to improve it. So there will be a lot of questions today. I really hope to get some very useful life hacks from you. Let's go around the table and start with this. What is sleep?
We'll do a little educational session with you because I've even watched your videos and I see that you really know what you're talking about. But in our medical universities, sleep medicine still isn't taught, and sometimes doctors graduate with almost zero knowledge about what happens to a person at night during sleep. And actually, you see, night is a risk factor for death here. People die more often at night than during the day, relatively speaking. Even the ancient Greeks said that the god of sleep and the god of death are twin brothers. And in fact, we have more than 70 sleep disorders. Oh God. I hope we'll discuss all of them with you today.
You probably know the effect that in the early hours, around 4 or 5 a.m., patients in critical condition in intensive care most often pass away. Thank you.
Yes. Actually, that's called pathophysiology. It's a term for certain pathological processes that occur during sleep, which contribute to the fact that people die more often at that time. By the way, for example, those people who receive narcotics, cancer patients, they often receive rather large doses of narcotics. And narcotics, in particular, suppress the respiratory center, and at night, our breathing regulation is already impaired. So basically, the brain sometimes doesn't quite understand when and how to breathe. Moreover, sleep apnea occurs more often at night. If a person also takes some serious doses of narcotics, they just fall asleep and basically don't wake up. On the other hand, maybe this is a very severe and already hopeless patient, and thank God, that's how it is. But it's also a well-known situation that such severe patients, when they're basically being treated palliatively, simply die at night from respiratory arrest.
And everyone thinks that sleep cycles are just about falling asleep and waking up, like turning off a television. Can you tell me what happens step by step?
Indeed, most people think that sleep is some kind of passive process. But in reality, research over the past few decades, maybe 30 years, has shown that it's an extremely active process. And let me tell you a bit about the physiology. In general, when a baby is born, they sleep 16 to 18 hours a day. You might think, well, is nature just being foolish? Instead of learning English right away or helping his mom around the house, all he does is eat and sleep, and it seems like sleep is a completely useless activity. But you'll soon understand why this is extremely important. A baby is born, let's say a boy weighing 3.5 kilograms, and by the age of 20, his weight becomes 70 kilograms, meaning his body mass increases 20-fold. And it's known that it's during sleep that the brain regulates the development of organs and systems, meaning it ensures that everything develops harmoniously. And obviously, when a child is growing actively, he needs more sleep so that the brain can control all of this, so to speak. That's the first thing. The second thing is, when a child is born, he dreams for about 6 hours, has dreams. Why so long? Because an adult only dreams for 2 hours. The thing is, in the first 6 years of life, a child learns 80% of all the audiovisual information that he will learn throughout the rest of his life. And all of this needs to be absorbed, processed, remembered, sorted, something's forgotten, and long-term memory formed. And this also happens during sleep, which is why a child sleeps so much. But later, as he grows up and doesn't receive as much new information, his sleep becomes much shorter. Furthermore, this process is not only structured but also varied. We have different stages of sleep: the first, second, third stages, and rapid eye movement sleep. The first stage is light drowsiness, lasting just a few minutes. Then comes the basic stage, the second, with K-complexes and sleep spindles, specific activity on the electroencephalogram. Next is delta sleep, the so-called deep sleep. By the way, that's when hormone production and energy accumulation occur. After that comes the rapid eye movement phase, rapid eye movement sleep with quick eye movements. That's when dreaming happens. And then you get a cycle. First, second, third stages, then rapid eye movement sleep, and then a brief awakening. This cycle usually takes about 2 hours, and then it repeats again. First, second, third, rapid eye movement sleep. First, second, third, rapid eye movement sleep. There are usually 3 to 4 such cycles during the night. But in the first half of the night, we have more deep sleep stages, delta sleep, and by morning, there are more dreams. So, our sleep has quite a complex structure like this.
How much sleep do we need, and how many cycles should we have?
There is, like the average temperature in a hospital, right? It's normal if you take the morgue and the intensive care unit together. Dark medical humor, but it exists. The average sleep duration, according to the American Academy of Sleep Medicine, is from 7 to 9 hours or about 8 on average, but there is variability in these parameters, just like with height. The average height for a man is 174. Well, we have, I always remember, Tenny Dorito, whose height is 155. Is he not a man? He is a man. Or our Poluev, for example. He's almost 2 meters tall, also a man. It's the same with sleep. There are average sleepers who sleep 7-9 hours, and there are short sleepers who need less than 7-6, sometimes 5, sometimes 4. It's well known that Napoleon slept for 4 hours, Thatcher slept for 4 hours, and so did Trump. I remember Uten, so to speak, is healthy. Everything is fine with him, and he also tells everyone that he sleeps 4 hours, although that still needs to be verified. I think there are long sleepers. Well, the most famous sleeper was Einstein, who slept about 10 hours a day, for example, and said that he couldn't sleep any less, otherwise nothing would be invented. And that's why everyone has their own genetically determined sleep duration.
And I can say from my own family, I have family members who, if they don't sleep 8 or even 9 hours, they just can't function. And it just feels like they're about to get sick, they feel terrible, they're in a broken state all day, while I feel pretty good. If I sleep for 5-6 hours, that's usually enough for me. On average about 6 hours, I go to bed at midnight and get up at 6. So it turns out that everyone has a different need for sleep. I have a question about that. I've heard this idea that you can sleep often and in small amounts, like in a 2-hour cycle. You mentioned these short naps, and I remember them from my own work experience. I used to work on an ambulance, and we would sleep on the first floor, and every hour or so they'd bring in a new ambulance. We'd lie down for a bit just to get a little rest, and then there would be this nasty call. We'd rush in, get up quickly to receive, process, and describe everything in 20-30 minutes, and then go back to lie down, sleep, and rest if we had the chance. So we take turns, one sleeps, the other stays awake, because sometimes someone is on the right, with us on the right. And the question is it even worth trying to catch a bit of sleep like that, sleeping in short bursts? How harmful is it?
If there is a significant lack of sleep, even 5 minutes of napping can help a person recover a bit, and with 15-20 minutes, a person can feel restored for a couple of hours. And when there is a lack of sleep, short naps, if we can call them that, are actually quite reasonable. It's a different story if you always sleep like that. Have you tried it for 10 days straight?
I've tried it, honestly, because I used to be on duty myself. I had my own shifts, but when I was studying, I also stayed for these, let's say, training shifts with my supervisors. I doze off in the admissions room, but by then, it's basically my second day at work. I mean, I came to work on Monday, and now it's already Wednesday, and I'm still on duty. There were times when I was on duty for 3 days straight.
Well, 3 days, but not 10 days.
Well, I had 3 days.
Well, so that's another 3 days. It's more or less bearable. But actually, a full cycle is 2 hours. And by the way, even in the army, when they change shifts every 4 hours, they still have 2 hours to sleep. So in this sense, a full cycle helps you recover better. You can function like this for quite a long time, but in 20 minutes, you can't fully repeat a normal sleep structure. And all these stories that Leonardo da Vinci slept for 20 minutes every 2 hours, well, is that something someone just said about him? So there is no reliable data, and it's quite possible that this is just another myth, just like there are myths about lethargic sleep. No one has ever seen it, but everyone talks about it, so there are more fairy tales here than science.
Brother Gudelica had different melodies set with different intervals for different times. He wakes up, turns it off, wakes up again, always battling those who made their coexistence possible. And I'm already awake. I hear one alarm goes off, another alarm goes off, a third alarm goes off, a fourth alarm goes off, and he turns them off, meaning he pressed snooze, wakes up, turns it off again. And how harmful or beneficial is this?
Everything should be in moderation here. As they say, I myself like, if I need to get up at 7 in the morning to set the alarm for 10 to 7. It rings and you press the button and there's exactly a 5-minute delay. Then it rings again at 5 to 7, but I've already fallen asleep, seen the continuation of my dream. I press the button again and watch the second part of the dream for another 5 minutes, and somehow I really like waking up this way. But when a person does this 10 times, 15, 20 times, and sometimes this waking up stretches out for 2-3 hours, that's already maladaptive behavior, which develops this kind of complex, difficult, I would say conditioned reflex to keep dozing off. So, first of all, we're destroying our sleep structure. In that case, just sleep for those 2 hours instead of waking up every 5-10 minutes, since you still won't rest well and will end up wondering, why didn't I get up? Why am I so tired? So here, if it happens once or twice, that's a perfectly acceptable situation. But when it goes beyond reasonable limits, like 5-10 times, then that's already the wrong approach.
Chronotypes, they do exist, and if they exist, is it possible to switch from one to another?
Yes, indeed, there are owls and larks. Owls are those whose schedules are always delayed. Their internal biological clocks are kind of slow. For example, when it's astronomically 12 o'clock, their own clock is behind. It's 9 post-meridium for them, and they don't want to sleep. Then it's 7 ante-meridium, but their internal clock says it's 5 ante-meridium, so they can't wake up. For larks, it's the opposite. Their clocks tick faster. They go to bed earlier and wake up earlier. And then there are pigeons, who go to bed and wake up on time. How was this determined? This was in the middle of the last century. In the experiments, people were placed in a cave without any time cues, where everything was the same: lighting, humidity, temperature. And there were no clocks, so the person started living according to their internal biological clock, which didn't match the time of day. Well, for example, roughly speaking, an owl-type person would sleep for 10 hours and stay awake for 20 hours and would continue living in this mode, regardless of the actual day and night cycle. But we have time setters that can speed up or slow down our biological clocks, and first of all, these are the time we wake up, physical activity, and light. And well, for example, today you're here in Moscow and tomorrow you fly to Vladivostok. Yes, of course, you'll have to wake up 7 hours earlier, and it will be terrible, it will be jet lag, but in 10 days, you'll start living there. According to Vladivostok time, your rhythms will speed up, start to shift, and eventually adjust to Vladivostok time. That is, we can gradually adjust or rebuild them, but it's impossible to change them completely. But you can coexist with them, and most often this concerns night owls, while everything around us is designed for short-sleeping early birds. So that everyone works less, gets up early, and rushes to work. And the night owls are ready to go to protests asking, where are the rights of night owls? Yes, that's how it is in our world. What shouldn't night owls do? First, a couple of hours before sleep, remove any stimulating activities, especially gadgets. This is really bad before sleep because a night owl's brain isn't very rested or tired yet. And then we add a gadget, more information, and so on. And next, don't consume caffeine-containing products for 8 hours before sleep because they stimulate you, and a night owl can't fall asleep either. And the most important thing is not to catch up on sleep during the weekends, they say.
I'll sleep this weekend. Is it possible to compensate for a long-term lack of sleep by just sleeping 10 hours on Saturday and Sunday? Does catching up on lost sleep during the week actually help, or is it impossible to recover? Let's put it that way.
As they say, every coin has two sides. The plus is that you've accumulated a sleep deficit, and night owls. They accumulate it by staying up late doing things in the evening, not wanting to sleep, but still needing to get up for work at 6 a.m. The deficit keeps piling up until Friday arrives. Well, the night owl is out until 3 a.m., then goes to bed and gets up. Instead of getting up at 6 a.m., they wake up at 1 p.m. feeling fantastically well rested, then go to bed late again and wake up at 1 p.m. on Sunday too, feeling even more fantastically well rested. But what happened? He shifted his internal clock by 6-7 hours later, so if he used to get up at 6 a.m. and now gets up at 1 p.m., that's a 7-hour difference. It's like he flew from Vladivostok to Moscow and started living on Moscow time, but on Sunday he has to go back. He needs to go to bed earlier, but as an owl, he can't fall asleep early and struggles to open his eyes in the morning, so he can't get up at all. That's because, again, it's like he's in Vladivostok after being in Moscow. The owl has to adapt. It's easier for him to get up later, but getting up earlier is just a disaster. And the adjustment will take about an hour, maybe a day. So just imagine he shifted his schedule by 7 hours, then comes back, barely recovers, and then the next weekend comes. And owls very often develop severe insomnia related to this kind of social jet lag. Remember how we talked about how harmful it is to switch to winter or summertime, moving the clock 1 hour forward or back in spring and autumn? Oh, it's terrible. People are dying. Cows stop giving milk. It's a complete disaster. And here, a person arranges for himself to fly Moscow-Vladivostok and back 4 times a month, or rather, Vladivostok-Moscow and back. And he thinks, well, I have trouble falling asleep, especially from Sunday to Monday, and then I just can't wake up. In the first half of the week, the recommendation is that the difference should be no more than 2 hours. But as for jet lag, I've experienced it myself. Maybe you could give some advice on how to deal with it. Well, there are professional methods to deal with it. For example, I sometimes consult politicians who travel frequently or sports teams. If you have a very important event somewhere and you need to shift your schedule by 5 or 6 hours, you can start adjusting your time zone even before your flight. For example, if you need to fly to Vladivostok and you have an important meeting or a sports match there, you can start going to bed an hour earlier each day before your flight, right here in Moscow. So you gradually shift your time zone closer to Vladivostok, and by the time you fly there, you're basically already living on Vladivostok time. It's another matter with truly serious politicians. As Nixon said, when he was flying around Southeast Asia, he lived on Washington time and said, "If you want to talk to the President of the United States, come when I'm awake." And sometimes if some major figure is flying somewhere, he just keeps living by his own time, and others have to adjust to him. And what else? Maybe melatonin can be used? Maybe we'll talk about melatonin separately. It helps to better adjust circadian rhythms, to speed them up or slow them down. There are certain ways and times to take melatonin, depending on whether you're flying west or east, but it helps you adjust to time zones faster. Sleeping pills can help you adjust when you need to sleep earlier, such as after arriving in Vladivostok. A short course may be useful, but it's best to do this with a doctor's guidance. So, should you go to bed hungry, not hungry, or have a little snack before sleeping? No, of course it's better to eat well. A pork knuckle, a bun, some tea, it's actually interesting. Digestion is an active process. Imagine, you eat a kilogram of food and to digest just 1 gram, your body spends about half a kilocalorie. So, if you eat a kilogram, you need to spend 500 kilocalories to digest it. And if you're an athlete, how much activity do you need to do to burn 500 kilocalories? Well, cardio, if it's intense, that's probably about an hour, right? That's running at a speed of about 12 kilometers per hour, I guess. That's super active. Digestion is like a blast furnace. You load everything in, the liver produces bile, the glands work, the intestines are active, the body is just actively digesting all of it. That's why, yes, the first recommendation is to stop eating 2, or even better, 3 hours before going to bed. But what does everyone forget? The second part is that dinner should make up no more than 20% of your total daily food intake. And not like when you skipped breakfast, maybe skipped lunch, and then ate everything you saved up throughout the day at dinner. And the next thing, which is also extremely important, is that we consume a huge amount of caffeine, even though just 5 centuries ago we didn't encounter caffeine at all. That's actually an interesting topic. You know, I can stump you too, maybe. I don't know if I'll succeed or not, but I'll try. Yeah, and we don't have any caffeinated recipes. The question is, how then? It's not clear what exactly caffeine activates in the brain. Indeed, we have adenosine receptors in the brain, but how does it work? We have adenosine triphosphate, but that's a molecule that sort of contains energy, if I can put it that way, when it breaks down. The breakdown product of adenosine triphosphate is adenosine, which, when it enters the brain, attaches to receptors, and the brain understands that the body is tired, that energy reserves are depleted, and it's time to rest. And caffeine, it turns out, is similar to the adenosine molecule. It blocks this adenosine receptor. Off to the side, yes, and the brain thinks, oh, how great, everything is fine, it can spend energy, there's plenty, but actually, it's using up some unknown reserves of this energy. When we wake up and have coffee, we've already gained some energy. Even if there's a slight drop after 4 hours, most people won't notice it. But when a person consumes 4 to 5 cups, including coffee, a day, these receptors are almost constantly blocked. Because the half-life of caffeine is 4 hours, which means that after another 4 hours, half of the dose remains. There is blood flow, and the body doesn't understand when it needs to rest, when it should, so to speak, take a little nap or something like that. But what does it do? So, what's the situation? That is, the body is working in overdrive, and it can't fall asleep because the body thinks it needs to stay active. And in 8 hours, the caffeine is washed out. In the morning, a person wakes up, and the excess adenosine settles on the receptors. And what does the person think? Oh no, I have no energy at all, my blood pressure is low, my head hurts, I have no strength at all. I urgently need to take 1 or 2 doses, maybe even 3 doses of caffeine just to feel normal again. And there's an interesting saying. At first, a person drinks coffee to feel good, and later, just so they don't feel bad. Yeah, that's interesting. But the good news is that caffeine addiction goes away quickly. If you stop all caffeine for 2 weeks, the first week will be tough. You'll feel withdrawal. But by the second week, you'll notice you're sleeping well, waking up easily, and your days just go better overall.
You mentioned melatonin, which I really like, and since I produce my own vitamins, I added a supplement called tryptophan to my product line.
There's such a product line.
Yes, that too. Well, it personally helps me with sleep disturbances because sometimes when you're preparing for a presentation, you take something and then you need to recover from all that. Tell me, what's your opinion on tryptophan and melatonin? And actually, I'm more interested in melatonin. What role does it play and who should take it?
If we take, again, well, I prefer to start by referring to guidelines or clinical recommendations and then comment on them. Yes, so we have the American Academy of Sleep Medicine, and most of the recommendations and standard guidelines for melatonin use come from them. That's jet lag, meaning the time zone change syndrome, shift work schedule. So when there's some kind of disruption, like when you need to sleep in the morning after a night shift, for example. Yes, and that's when, one way or another, there's some kind of disruption of the circadian rhythm. And the second group is elderly people, people over 55 years old, although I'm already 58, so I guess that already counts as elderly. So, when your own melatonin production can decrease, especially the melatonin production peaks before sleep, if we add this peak with external melatonin, a person falls asleep better. But there are studies that show if a person has a routine, is young enough, and produces their own melatonin, then simply adding external melatonin won't have much of an effect. So, in most cases, melatonin is recommended when there is some kind of rhythm disturbance. So, for example, if you need to go to bed earlier or later, that kind of situation. Or for older people who potentially don't have enough of their own melatonin. By the way, I have a very interesting effect from melatonin. Colorful, vivid dreams. Does that ever happen to you?
Rarely. I have colorful dreams.
But for me, it's melatonin. It usually lasts for 1 or 2 times. And by the 3rd time, it goes away. But then you start thinking, maybe it actually happened? So, basically, they're not exactly hallucinations, but they're very vivid, colorful, and memorable.
I rarely have dreams, and in your book there's a category called Livki, who don't see dreams. What's wrong with them? Wow.
Come to my office. We'll do a magnetic resonance imaging electrocardiogram, Holter monitor, and a colonoscopy. Yes, it happens. Sometimes patients come to me and say, "Doctor, I don't dream. Let's do some tests." But this is still medical ontology. In general, there's no need to run any tests for this. It's a normal variant. Everyone dreams. It's a genetically determined state. It's just that some people remember their dreams and some don't. If a person wakes up directly during the rapid eye movement phase of sleep, they can describe what they were dreaming about. But for some reason, some people don't wake up during this phase while others do. After rapid eye movement, sleep ends. Just 5 minutes in a different sleep stage is enough for a person to claim they didn't dream. But if we, for example, and there are such studies, conduct research and see that rapid eye movement sleep is happening right now, how do we determine that? Someone is asleep and their eyes move quickly beneath closed lids. There's also distinct brain activity at that time. And if you wake someone, even if they've never recalled dreams, they'll describe what they were dreaming.
The question is, we know how much sleep we get, but what about its quality? Because from what you said, I understood that it's not only important to get a certain amount of sleep, but its quality is also very important. Well, for example, if you're being woken up all night, constantly getting up to go to the bathroom because of some illnesses, that's not very good. So how can you make your sleep better?
That's a kind of, multifaceted question, like how do you make life better?
Let me ask separately for now, Nastya. Tell me, how important is the quality of sleep?
Well, I'll say that if you had a bad night's sleep, you'll have a bad day. And if you had a bad day, you'll have a bad night's sleep. It's like the chicken or the egg question. And in this sense, of course, the quality of sleep is an extremely important aspect. What is it? There is actually a quantitative definition. First, you should fall asleep within 15 minutes, meaning you shouldn't just lie there thinking, oh no, I can't fall asleep. During the night, you should have no more than 15 minutes of total awakenings, and in the morning, you should get up and be able to start your normal workday within 15 minutes. Well, maybe you feel a little bit like you didn't get enough sleep. Actually, there's a good saying. If you want to stay slim, eat a little less. If you want to sleep well, sleep a little more. Go through your day so drowsiness doesn't bother you, and by evening, you're tired enough to fall asleep in 50 minutes. How does that sound? Benjamin Franklin said that fatigue is the best pillow.
But as for dreams, well, click. My mom had one like that. She said someone gave her a dream book, and sometimes things would blend with lyrics for me. She would sometimes flip through the dream book. So, tell me, is a dream generally a product of transformed thoughts, like you think about something during the day and then you dream about it at night? They gave the result? Or is it something that's not connected to what's happening in reality? And should we even think about it like looking into dream books, trying to see some special meaning in them?
Imagine this situation. We agreed to meet today, that I would come to your show and then I call you. I had a dream that I went outside and was attacked by an angry dog, so I didn't leave my house and didn't come to see you. What would you think about me?
I would think that you are a very superstitious person.
And what if you were my boss, and I was a surgeon who said the same thing to my boss?
I wouldn't take that as a valid reason. I would say, go ahead and come in.
Yeah. So here, I'll say this. It's something to think about. Actually, I love this example about the angry dog. What if you just saw in the yard that your neighbor is always walking his bull terrier without a leash? And at some point you went outside and that bull terrier jumped on you and bit you, so it's a kind of prediction of a situation that could potentially happen. Or a person dreams that they'll be hit by a car, then they go outside and it actually happens. However, for a week before, he crossed the road at the wrong spot, despite the crosswalk only 100 meters away. Most say, you're an idiot, use the crosswalk or you could get hit by a car. But it's always a probabilistic prediction. It might come true or it might not. So you can think about it, you can analyze it, and even act on it using normal logic. There's a good saying, if you dream that horse number 6 will win at the races, go ahead and bet a little money, but don't mortgage your house for it. That's the first thing. It's a probabilistic prediction. The second thing is that these are the most self-fulfilling predictions. I always remember a ballerina from the Bolshoi Theater. We once took part in a show together. When I was 7, I dreamed that I was performing on the stage of the Bolshoi Theater. Listen, but what have you been doing since you were 7? He practiced ballet 10 hours a day. Well, listen, that's just a dream, a vision. It was just an idea that was really important to you. There are just ordinary coincidences. That's what most people usually think. Imagine you're a careless student and you spent the whole year goofing off, but then you studied right before exams. You dreamed about ticket number 5 and you only studied ticket number 5. You came in, drew ticket number 5. Well, that's it, fate for sure. But let's say there are 100 tickets, so with a 1% chance, you could have easily picked ticket number 5. There you go. So this is just a high probability prediction. We don't consider it a prophetic dream. For example, I dreamed I went to work tomorrow. People ask, how is that prophetic? How could I dream about the future?
Isn't that right?
Come on, haha. So, with low probability and a prediction, for some reason a person thinks it's a prophetic dream. In general, I'll put it this way. As for dreams, they are unprecedented combinations of familiar events. That is, it's an analysis of previous information. Basically, the brain takes everything we've accumulated in our working memory during the day, analyzes it, sorts it out, decides what to keep, what to forget, and how to act next. Moreover, it takes something from previous experience and overlays it on what it saw yesterday, for example, and gives a forecast for the future, how to act in a completely new situation.
In fact, it's a kind of memory defragmentation, yes?
Yes, that's absolutely right. It's like the RAM got cluttered, and the brain needs to turn this short-term memory into long-term memory, clear it out, so that tomorrow a person wakes up and starts filling up the RAM again.
And why are some people's dreams in color and some people's dreams in color?
It's still not completely clear. The only thing is that people in creative professions are usually more sensitive or receptive. They see colorful dreams more often, although, for example, heavy smokers also often see colorful dreams more often than non-smokers. So there is no real connection here, like they used to say that seeing colorful dreams is somehow related to schizophrenia. Yes, but in reality, it's just like saying teeth grinding means you have worms. Colorful dreams have almost nothing to do with schizophrenia, and teeth grinding has almost nothing to do with worms.
That's bruxism, right? Tell me, what does bruxism have to do with sleep?
Yes, it actually happens during sleep.
Why do some people have it and others don't?
This is quite a complicated process because even making a decision about what to do is difficult since there are so many different reasons. Sometimes it's not clear at all why some people have problems with dental crowding, like it's not just that a tooth was fixed or a jaw was fixed. Bruxism can begin in childhood for some and may be inherited, as some parents also have it. But just stress can make bruxism worse, and a lack of vitamins and micronutrients can cause or worsen bruxism. And often, sometimes you have to take some therapeutic measures without even understanding why it occurs. Nowadays, they most often use separating mouth guards, such silicone mouth guards that simply separate the teeth, and accordingly they get less injured. Because the main problem is not even the sound that bothers others, but the fact that the teeth break, wear down, and in general get injured. By the way, botulinum therapy helps quite well too. They inject it into the corresponding muscles and they relax more. And of course the person doesn't stop chewing. At the same time, she will walk around with her jaw open all the time, but it effectively eliminates bruxism for several months.
The question of predicting illness and sleep. Can sleep really predict your illness?
Here, of course, when our brain falls asleep, do you remember when I mentioned this, when a baby is just born? What does the brain do? It works on restoring the body, like a technician who checks how the heart is working, how the kidneys are, how the liver is, and so on and so forth. And those centers of the brain that interact with the environment during the day, like chasing, running away, fighting, basically interacting in some way, they switch to working with the internal organs, fine-tuning their function, removing toxins, cleaning the brain itself from toxins as well, and so on. Stimulating the immune system, growth, and so on and so on. And it's clear that the brain starts to better perceive signals from the internal organs. The only thing is, it's not exactly a direct signal like that. But it's not like, make an appointment with the doctor, go see a cardiologist tomorrow, you have atherosclerosis in some descending artery. Or, let's say, a dog bites you in the stomach and a person has an exacerbation of a duodenal ulcer, for example. Or maybe some kind of intestinal cancer that's developing. And during the day he didn't feel anything, but at night, there you go, the body somehow sent a signal. So this kind of situation is possible. Or, for example, sleep apnea, when a person often dreams that they're being drowned, that they're in some stuffy room, that they're suffocating, and the person is actually suffocating because they have several hundred breathing stops during the night.
The question is about breathing stops and snoring. There are even different devices. It actually looks like, a torture device, honestly.
Yeah, I have 8,500 patients at home with such devices. It's a continuous positive airway pressure machine. Some have been sleeping with them since 1995.
We treat snoring as something that just prevents our family members from sleeping well. But what is snoring actually? What are you concerned about if a person sleeps and snores?
Well, I want to tell the viewers directly that snoring is dangerous. You could say it kills. It's not the snoring itself that kills. It's a sign of airway narrowing and the walls of the airway hitting against each other. It could be obesity, it could be enlarged tonsils, problems with a receding lower jaw, smoking, alcohol, or decreased thyroid function. Many reasons exist, but all result in airway narrowing. When a person falls asleep, muscle tone decreases, the mobility of the airway walls increases, and sometimes the situation occurs where they completely collapse. In fact, this is an episode of suffocation caused by the blockage of the airways at the level of the head. The brain is still asleep, it doesn't sense it, it sends breathing impulses, so the patient tries to breathe, but nothing works. 10, 20, 30, 40 seconds, 50 seconds, a minute or two. Sometimes we see how our device, the examination, is going in an impulsive mode. All this is saturation. The blood oxygen level drops to 90, 80, 70, 60, 50. You, as a doctor, what will happen to a person if the saturation is 50?
Nothing good, but I can say that very few people can go without breathing for that long. One of the tests, which I discussed with Professor Klinichnik, is that one of the tests of your physiological integrity is the ability to pinch your nose, relax, and hold your breath for a minute. Not everyone can do it, and especially those who snore. Those are not the healthiest people.
But what's the connection with breath holding? When a person exhales and then tries to inhale, the airways collapse. And sometimes I show a person, look, you can hold your breath for a minute and a half, but now exhale and try not to breathe. 15 seconds, 20. When it's already 89, a person can't consciously hold their breath anymore. At 70, they're stronger. At 60, they lose consciousness. At 50, the brain goes dark after 30 seconds. And we see that a person, for example, has 20 episodes during the night with a saturation of 50, which means they're already 30 seconds away from death. There were also such episodes. These collapses can happen several hundred times. During the night, a person can sleep for 8 hours, and out of those, a total of 4, 5, or 6 hours, and record holders, out of 8 hours, 6.5 hours. Mine don't breathe with severe oxygen deficiency. Shallow, restless, non-refreshing sleep, nighttime and morning arterial hypertension, night sweats, mainly on the head and neck, headaches, belching, and frequent nighttime urination. This is closer to your situation. We might discuss it more later. The thing is, under stress, the kidneys produce more urine, and a person starts getting up 3, 4, or even 5 times a night with an almost full bladder to rush to the bathroom. Polyuria, yes, true nocturnal polyuria. It's not just an urge with only a few drops, not prostatitis since there's no pain or burning, and not an adenoma where urination is difficult or the stream is weak. Here, they get up easily each time and urinate without trouble, but still go 6 times a night. Obviously, that's not pleasant, having to go 6 times in 2 hours. And moreover, there's even something called toilet syndrome, when in severe cases, a person sits on the toilet and falls asleep. And when sitting, the airways collapse less because when he lies down, they collapse. Especially since our tongue falls back, and when sitting on the toilet, I fall asleep, wake up, everything is numb, but I slept pretty well. There's even such a thing as toilet syndrome. So this is actually a very serious disease that increases the risk of hypertension, heart rhythm disorders, and diabetes. Strokes, heart attacks, and even sudden death during sleep.
So what are the criteria for saying that I sleep well? I can't really assess that myself, since it can depend on many things. Well, for example, I'm depressed, my hormones are off, I have problems with my adrenal glands, they're just exhausted, burned out. So how can a person figure out that their sleep isn't working the way it should and isn't helping them recover? Are there any warning signs or criteria to know if you have a sleep problem, friend?
Well, there are some simple tests, literally just 4 or 5 questions or maybe more. It takes more than 15 minutes to fall asleep, like we mentioned. The criteria for normal sleep is falling asleep in less than 15 minutes total. Frequent awakenings, restless or unrefreshing sleep, already using sleeping pills, and feeling sleepy during the day. Well, that's just basically how we assess the symptom of poor sleep. But let's understand that a symptom alone doesn't mean illness, and sleep, just like a fever, is a diagnosis. Yes, it could be the flu, it could be COVID, it could be arthritis, it could be, I don't know, something else.
A fly or even neurology, yes, anything.
Whatever you want. Maybe your body temperature rises. And first of all, when we have poor sleep, we need to understand. As I mentioned, there are already 70 different sleep disorders, and there are also a lot of diseases like frequent urination or diabetes or neurological disorders and so on, which also affect the quality of sleep. And that's why sleep centers are being created all over the world, which deal with the fact that when a person comes to me with a sleep disorder, my initial consultation alone takes an hour and a half to carefully collect the medical history as a foundation. Then, as you correctly said, we take a certain amount of tests. Vitamin D deficiency, B vitamin deficiency, lack of magnesium, lack of calcium, lack of iron, maybe testosterone as well, all of these too. There are described situations when a person starts walking, starts sleeping, so here we collect tests. Then we also assess the person's psychological status, identify any psychiatric problems. Sometimes a person just comes in, like one guy I remember who came to me already on 2 medications, antipsychotics and antidepressants, after seeing neurologists and 2 psychiatrists. For a year, he's had severe insomnia, can't fall asleep at all. I start taking his medical history. A year ago, he switched to remote work, bought a coffee machine, and started drinking 10 cups of brewed coffee a day. And for some reason, he started having trouble falling asleep. And the doctors, without asking what he was doing at home, just said, "Oh, you're sleeping badly, here are some pills." But we stopped all that coffee, and in 3 weeks, he was falling asleep perfectly fine. So, you see how interesting it can be, or with the same social jet lag, when a person sleeps in on Sunday and then can't fall asleep normally afterward. So, there's a huge amount we need to study to understand this. Sometimes I'll say it's really serious. This is quite medical, involving examinations, making a diagnosis, clarifying the causes, and prescribing treatment.
And people who work in shifts, it really affects their health. And how can they even follow your advice?
You know, I'll ask a question like that too. What do you think? Especially since I'm involved in sports, what does it take just to endure life's hardships? How should one live, doing hard work?
What kind of health you need?
Yeah, and how is it mostly achieved? Sports, nutrition, getting rid of bad habits, keeping a routine, basically just leading a healthy lifestyle. And the healthier you are, the longer you'll be able to handle shift work. Sometimes it happens that when a person comes to me, they already have problems with their thyroid function, like hypothyroidism or hyperthyroidism. They have a duodenal ulcer, irritable bowel syndrome, their migraines have gotten worse, neurodermatitis, their skin is getting worse. Well, sorry, my dear friend, but you have to choose either your health or your job. So sometimes I have to advise someone like, you need to think about it, my friend. I had a patient.
He was a director, I think, and his requirement was that he couldn't stay in a room with someone else. He couldn't sleep when someone was there. So the question is this just some kind of whim, or is it a psychological trait? He can't even fall asleep at home with his wife, he says. My wife and I don't sleep in the same room. We've been sleeping in different rooms for 20 years. I just can't do it any other way.
Sleep, actually, the quality of sleep, the depth of sleep is individual for everyone. And there are some super sensitive people. If a nearby neighbor moves or makes a noise, that's enough to wake some people up, while others wouldn't wake even if a cannon went off. So, in general, this is also a genetically determined condition, and a person can simply experience lighter sleep since childhood. And there's also the concept of reactive sleep, meaning that even the slightest stressful situation causes an increase in sleep, and the person reacts to it. There are even various tests that determine, in a basic assessment at a test center, for example, the presence of this kind of reactive sleep. By the way, these people most often develop insomnia against the background of stress, and yes, some people have this feature of the body, light sleep. And here we need to remember the good old pre-revolutionary times, though not among the peasants, but among the boyars. The women's side, the men's side, they came, socialized, fell in love with each other, and then went their separate ways, each to their own side.
There are those who like to eat a hearty meal, and after that, their surf usually makes them sleepy, so they go, so to speak, to take a little nap for an hour. I've heard that it's not very healthy when you eat a lot during the day and then go to sleep afterward. I have 2 questions about short naps. First, is it harmful to sleep right after you've had a heavy meal? And second, is it true or not? If a person especially snores, you can get a sound from the airways because of that.
As for the second question right away, when a person has apnea, their airways get blocked and they try to breathe, the abdominal wall tenses up and the stomach is actually compressed. And if there is food in there, there is a high chance of belching and naturally the release of stomach contents. and it's acidic, so if it gets into the airways, it causes a burn to the respiratory tract. And by the way, such patients often have a very frightening symptom when a person wakes up. They are conscious, but they can't breathe. And after an apnea episode that lasted a minute, their oxygen saturation is at 70, they're blue, and the person can even lose consciousness. So it's extremely frightening. The person thinks, I'm suffocating and I'm going to die, and then loses consciousness. He comes to his senses later, but the first thing he does, of course, is run to the doctor and say, "Doctor, that's it. I can't sleep anymore at all." This is what's called laryngospasm in response to the collapse of the airways, because just 0.3 milliliters of stomach contents is enough to get into the airways. A sharp spasm occurs, and if 20 milliliters get in, then, excuse me, that's a real problem, as our former chief doctor used to say. In other words, the bronchi get obstructed, and that's it. And by the way, this unfortunate situation often happens with overweight patients who have apnea, who like to eat at night and wash it all down with alcohol, and alcohol relaxes them even more. Again, this gastric sphincter. So how does severe apnea happen in this case? When we have belching or vomiting, our respiratory center is suppressed. Babies often spit up, and adults can vomit too. Someone throws up and nothing serious happens, but then someone else shows up. Imagine a person is sleeping, they have a breathing pause for a minute, their oxygen saturation is at 70, and they're still trying to push through. And then there's the regurgitation of stomach contents, which stimulates the brain, burping, and the brain wakes up. And instead of suppressing the respiratory center, it sees that there's an oxygen catastrophe, sends a command to inhale, the person breathes in, and that's it. That's what happens. There have been sad cases described where people with apnea abuse alcohol and end up sadly losing their lives this way.
Since we're talking about sleep pathology, and we've already started touching on this, I've experienced a frightening phenomenon a few times in my life called sleep paralysis. Before I experienced it myself, well, we studied it at the Institute. I woke up and someone next to me, I think one of my relatives, also woke up. From the feeling that someone's hand was not even on my chest, I would say, but right on my head. And I even heard some voices. I thought they were crazy. I analyzed it later, but at that moment it was wild and scary for me. When this happens, your instinct is to jump up, turn around, and see what it is. And I even kind of felt that there was something here, but I couldn't do anything. I couldn't even eat. Not only could I not move at that moment.
It's impossible for people to even open their eyes.
But I could see. My eyes were open then. I saw my grandmother, who was on the couch. She also bent down, and it lasted for about 10 or 15 seconds, that horror. It was such an unpleasant horror. I think it happened for the first time when I was about 13 or 14 years old. Then, at that moment, I somehow moved and literally darted forward about 5 meters and quickly turned around. Of course, there was no one there. This happened to me again. All throughout my life, and each time it wasn't connected to rugs or tobacco. I don't drink or smoke, and I have read and watched. That's what they call it, I think, something to do with a witch, with being nearby, something smoky. Yeah, there's some name about a witch, but actually one of the names is exactly how they properly call them, demons, or like evil spirits. Someone assigns it some mystical meaning, but I can't recall the name.
Really?
But this sleep paralysis, why does it happen and how do you deal with it? Because for me, okay, it's happened 3 times in my life with a solid break in between. But I read on the internet about guys who suffer from it almost every other day or several times a week, and it's been going on for many years. That was terrible. They've even kind of gotten used to it in a way. But every time it's really wild and unpleasant.
I'll start from a broader perspective so you understand the logic. Once, my colleague, a somnologist, was describing a drug addict while on duty. I asked, "How long have you been suffering from addiction?" He said, "What do you mean suffering? I'm not suffering, I'm enjoying it." So it's interesting that if you explain to people what it is, some start to get this kind of joy from this feeling, from sensations that aren't physical. Yeah, well, I understand that you probably can't just tell this to someone who's running around in a cartoon or something, but I'll say this: everyone experiences sleep paralysis. Strangely enough, it's actually a physiological feature of sleep when we have dreams during rapid eye movement sleep. Our brain is actively working, sending commands like chase, run away, fight. But those commands don't reach the body, meaning the brain seems to be active, but the body is immobilized. This is called a neurochemical block, and the brain's commands don't reach the body or the spinal cord. But what happens when there's some kind of minor malfunction? Part of the brain is still asleep and continues the dream, causing sleep paralysis, while another part of the brain has woken up and starts to perceive the surrounding environment. And what happens is that the dream actually intrudes into wakefulness, and sometimes a person even starts to see or feel that they're in the room or see things there. There's a snake crawling on the ceiling toward him, and he can't move, or maybe some kind of demon is sitting on him. People often say they feel something sitting on them and pressing down, but that can be explained too. Our breathing, we can consciously control it, breathe faster or hold our breath, but when we're asleep, it works automatically, regardless of consciousness. And when this situation with sleep paralysis happens, breathing continues automatically, but we want to take a breath and we can't, and our breathing doesn't respond to that at all. We feel as if something is choking us because we can't control our own breathing. And the next situation is that this dream can actually be visual, it can be auditory, or something else, right? Naturally, it scares people, especially if they don't understand what it is. But again, it's a physiological phenomenon that occurs. By the way, people are still debating about it. Phenomenon, in the medical sense, you can use both versions. For the critics who say it should be phenomenon, phenomenon is also possible. So that's how it is. And what should you do? First, our eye movement function is preserved, meaning we can move our eyes even under closed eyelids. You can just start moving your eyes back and forth and then try to blink. So, first the blinking function is restored, then you can start making faces because the facial muscles begin to work more actively. Try to run away or stick out your tongue and make a face. After that, all other functions recover fairly quickly. But I'll say that if you explain to a person that this is a safe situation, what can you do? Just like, watching a movie, like a kind of lucid dream. Well, almost a lucid dream, and you don't feel your body and basically watch it like a thriller. Oh yeah, I dreamed about it. Well, a monster. That's cool. I talked to it. It was nice. So the point is, forewarned is forearmed.
And if a person, let's say, talks in their sleep, I have a friend. He works as a psychologist. In his sleep, John Skemmy said something to him and his wife got offended. He asked, "Why are you telling me this? It just came to me in a dream." They were walking with some girl, something happened, he was saving her from someone, and she even teases him about it. Excuse me, but should we really pay attention to what we say in our dreams? Well, for example, your wife suddenly speaks in a man's or someone else's voice.
There's a good saying, one name during the day, and you're married, one name at night, and you're divorced. It's not so important what you say in bed, but rather what name you say and whose it is. Sleepwalking and sleep talking. Well, basically that's somnambulism. Let's start with sleep talking. This condition is often inherited. If your parents walked and talked in their sleep, you likely did as a child, and your children probably will too. Basically, this is not a situation that is medically dangerous, meaning it does not lead to any physical or mental developmental disorders. The only important thing is to create a safe environment in the bedroom for children and for adults as well, because you might get up, bump into something, or cut yourself. Children should not be on the top bunk, and if there are any stairs, they should be closed off with special gates. If children fall out of windows, that's also known, or fall downstairs. People say that sleepwalkers walk on rooftops and everything is fine, but nothing good ever comes of it. Actually, maybe they won't fall, but they might. That's the first thing. Second, if a person still talks in their sleep as an adult, this can, of course, cause a certain degree of social maladaptation. First, it's better to tell your significant other right away. I tend to talk in my sleep, just so you know. It's good to give them a heads up. Second, for those who talk in their sleep, it's actually better not to talk. That is, as soon as someone starts asking questions, the person usually tenses up and wakes up, but they can talk on their own. And in this sense, there's even a kind of professional restriction. Well, let's say you're undercover somewhere, maybe a scout or something, and you don't talk? So basically, such people aren't accepted into the relevant security agencies, for example, and in fact, there's no way to fix this. I mean, you could, for example, give medications that would suppress sleep talking, but the risk of developing a dependency, say, on tranquilizers from these medications is higher than the risk of you saying something in your sleep. Another more dangerous situation is when active sleepwalking and sleep talking suddenly appear in adulthood. This could indicate the onset of Alzheimer's disease, some kind of vascular problems or dementia. It could even point to a brain tumor. In these cases, an exam is needed to identify issues in elderly people.
We had a podcast, and it will probably already be released by the time our podcast with you comes out. And there, a colleague with Phil Farquhar, he told an interesting story specifically about leukomonatism because before he shared this story, I had a different attitude towards it. She would get up, walk to the kitchen, and go there, bumping into things herself. He mentioned something in the room. I remember Pax. That was the last name. Can you forget it? He woke up, went outside, got into the car, and drove a huge distance, not directly but turning everywhere. He went into the house to his foster parents, with whom, by the way, he had an excellent relationship. He stabbed his mother, I think, and strangled his father, but it turned out his father survived. I think there was someone else there because he lost consciousness, stopped strangling, and woke up sometime later. There, after about 2 or 3 hours in the car, when he found his hands covered in blood, he called the police himself and said, "I think I've done something terrible." And there were a lot of tests. They checked if maybe he was pretending, but first of all, there was no urine, and secondly, there really wasn't anything else. An interesting fact, when he was killing them, he didn't hold the knife by the handle. He held the knife in his hand, in his bare fist, hitting without feeling any pain. That's how he delivered the blows. And he was so distressed that I think he even ended up committing suicide. So I have a question. Tell me, if there's a person, how do you kill him? I don't know what happened. Sometimes it's dangerous or really offensive, or maybe it's just a 1 in a million case.
But it's a 1 in a million case, and it's still unclear there. Because actually, during sleepwalking and similar states, there are no quick reflexes, meaning a person can't act quickly. We also have another disorder called rapid eye movement sleep behavior disorder, when the neurochemical block doesn't work and commands from the brain, like run or fight, make the person start acting out the plot of their dream. These situations are well known, and at times people even harm or kill their bed partners. He's some kind of special forces guy, and they laugh that he's fighting, but his wife, who is small and thin, is lying next to him, and in his sleep he actually strangles this person. And this is a documented case, even if it's just standard sleepwalking and sleepwalking. A person can go out, can go downstairs, he can even start a car, but usually he won't be able to turn or shift gears. Okay, he might still be able to drive without shifting gears or turning, because he won't be able to do it quickly. And in this sense, the medical experts faced a very difficult task here. Was it some kind of clouding of consciousness, and was it classic sleepwalking? And how is this sleepwalking different from classic sleepwalking? Well, there are many cases described like this, when a person is in a state of insanity and does some terrible things, and only later it turns out that he doesn't remember anything at all. Here, this is not classic sleepwalking, I repeat. In general, if you meet a person who has woken up and is going somewhere, he might have his eyes open, but he doesn't understand anything. As a rule, it's an absolutely peaceful being. If you just turn them around, especially with children, if you turn them, lay them down, gently stroke their head, they'll fall asleep. The child will wake up and won't remember anything in the morning. By the way, the main thing is not to wake them up. Otherwise, imagine the parents asking, "Where are you going?" He wakes up confused, sees his scared parents, and becomes disoriented. And the very fact that he was walking around and you laid him down, he won't remember anything at all. So in this sense, a sleepwalker is usually an absolutely harmless being.
Sleep and our hormones. If we sleep too little, as far as I know, if we regularly miss 2 to 3 hours of sleep a day, our hormone levels are affected. Our testosterone level, for example, can differ by as much as 10 years. In other words, you are hormonally aging by 10 years. And the level you end up with will be different from what you could have had, and you'll be walking around with the level you would most likely have in 10 years. Tell me, what else in the body, in terms of hormones, is important? We put ourselves into a deficit. If we don't fall asleep...
Let me put it even more simply. If you deprive any mammal of sleep, it will eventually die. Internal organ function is disrupted, thermoregulation fails, immunity declines, leading to ulcers, sepsis, and death. And by the way, interestingly, when these poor mice or rats are dissected, the least amount of damage is found in the brain, even though the brain isn't sleeping. Remember how I said that it performs functions related to regulating the work of internal organs and systems? If you don't let it sleep, it itself won't suffer much, but the organs and their functions will be affected. And in this sense, when patients come to me and say, "Doctor, let's somehow reduce sleep, let's drink less water, or let's breathe less," how will that end? You'll die. And when we deprive ourselves of sleep to some extent, we'll talk about that now. We're basically taking a health loan from our body and we'll have to pay it back with interest. That's the situation here as well. Testosterone and growth hormone, somatotropin, are produced during the deep stages of sleep. Children are said to grow in their sleep, but growth occurs all day, with hormone peaks at night during deep sleep. And by the way, children who sleep poorly, especially those with sleep apnea, kids can also have severe apnea, especially because of enlarged tonsils or adenoids. And those same 300 to 400 breathing pauses that disrupt sleep structure also cause a drop in growth hormone production. And these children grow poorly physically, their physical development is delayed, they have less muscle, and they are short in stature. What's interesting is, I was giving a lecture, it was 2013 in Krasnoyarsk, and I was talking about how children with sleep apnea caused by enlarged tonsils, because Lauren was giving a lecture, experience a drop in growth hormone. They don't develop physically well, but if you remove the tonsils, the child starts to grow actively. And then an elderly woman, about 70 years old, stands up and says, "After the war, my teacher used to say that if you remove a child's tonsils, they grow well. Only now, after 60 years or maybe 50, I finally understood the connection between removed tonsils and the fact that the child grows well." And now let's get back to testosterone. Let's talk about the same case. A 43-year-old man came to us for rehabilitation in a sanatorium after severe toxic hepatitis. Here's the analysis. Around the age of 40, he became a big boss. He started riding in a car and we began driving him back and forth. He gained about 15 kilograms over these few years, and he started complaining that his libido had decreased and his potency had gone down. And he goes to the bathroom to urinate 4-5 times a night. He's quite a big boss, but of course everyone decided to treat him. Over a couple of years, he was consulted by 10 urologists, andrologists, and so on. He took 15 courses of antibiotics and uroseptics prescribed by such specialists, was diagnosed with prostatitis, adenoma. Well, there was some adenoma, but as it turned out, it was completely insignificant. Nothing really helped. Then they prescribed him Bidon, and things got even worse. Well, not Bidon actually. It was basically testosterone. Yes. And when he was prescribed these courses of antibiotics, if you kill all the flora, fungi start to grow, right? So, for systemic mycosis, he was prescribed antifungal medications, and one of the serious complications of antifungal drugs is toxic hepatitis. He successfully developed it, so to speak, and then, after spending some time in intensive care, he lost 10 kilograms and was admitted to us for rehabilitation. And we just asked him questions, and it turned out that even before all this, when he was around 40, he used to have tonsillitis. Every year we examine his throat, and he has these huge kissing tonsils that touch each other in the middle of his throat. Overall, well, he did lose weight, but still there was some degree of obesity left. We did a polysomnography for him, put on all those sensors that monitor what happens to a person during sleep, and it was terrible. We saw 70 breathing stops per hour and the same 4.5 or 5 hours in apnea during the night. If our sleep is disrupted and we lack deep sleep stages, which he almost completely did, it affects us. Testosterone production drops, that's one, and accordingly there are problems with potency. The second person can't get enough sleep. Imagine, 500 stops means 500 times someone is knocking on their brain saying, breathe. No matter how much they sleep, they never feel rested. Libido decreases, well, because the person is simply tired and has low testosterone, but urologists think that everything is just a urological issue, and so they keep treating and treating it. But we rehabilitated him and sent him to the ear, nose, and throat surgeons. They removed his tonsils, and 2 or 3 days after the surgery, his frequent nighttime urination disappeared, and a month later, his potency was restored. It would seem, what's the connection between tonsils and potency, right?
I recently had a patient with testosterone deficiency as well, secondary hypogonadism. His testosterone levels were normal, but based on all the symptoms and complaints he had, it seemed like he had hypogonadism. He felt better on testosterone, but in his case, the reason why testosterone wasn't working turned out to be his tonsils as well.
And that's
An inflammation that I couldn't see in regular tests. But with a deeper examination, I think he saw a specialist, and when his tonsils were removed, his testosterone became sufficient. And yes, indeed, tonsils can manifest themselves in this way.
if it's chronic, if there's a chronic infection there, then the body doesn't really respond well either.
Now, regarding weight gain, poor sleep is always associated with gaining weight, and that's because hormone levels decrease, yes, but in fact, it's also related to how our body regulates how much we store or spend while we sleep. Or maybe there's a connection I don't know about.
There is a definite connection. The thing is, when sleep structure is disrupted, it increases the production of ghrelin, and ghrelin is a hormone that increases appetite. And generally speaking, probably from an evolutionary perspective, if a person didn't get enough sleep, most likely the body understood why they didn't get enough sleep. Well, because you had to run away from someone or chase after someone, not just rest in caves. Or wherever he lived, an increase in appetite would kick in, meaning he needed to make up for some energy expenditure. But now, as we sit next to the fridge, we're not running from anyone or chasing anyone, yet for some lofty, pure, noble ideas, we deprive ourselves of sleep. The body senses a lack of sleep and produces ghrelin. Next, the production, or rather, the sensitivity to leptin decreases, and leptin is the hormone that gives us the feeling of fullness, and in particular, it also, if its level drops, then our sensitivity to insulin also decreases, which can potentially lead to the development of diabetes. And if sleep isn't completely disrupted yet, the growth hormone level also drops. In children, it's responsible for growth, but in adults, it serves a slightly different function. It has an anabolic effect. You probably know that athletes sometimes even inject it to help their muscles grow. And if there isn't enough of it, the food that comes in doesn't get converted into muscle mass, but mostly turns into fat. So what happens is, if a person doesn't get enough sleep or their sleep is disrupted, their production of growth hormone drops and most of the calories get converted into fat. On top of that, their appetite stays the same. They want to eat and they don't feel full, so they end up overeating. Again, when this gets stored as fat, if we don't have enough growth hormone, it's hard for the body to take that fat out of storage. So this is the perfect situation for gaining body weight. And by the way, women have the same mechanisms. Maybe not testosterone, but the same ghrelin and leptin are at work. Just recently, a study came out involving 63,000 women. I don't remember exactly, but it was a lot. And they observed them for almost 10 years. There was 30% more obesity if women slept less than 6 hours. So in general, yes, it's obvious that lack of sleep specifically disrupts our hormonal balance in a way that contributes to weight gain.
Insomnia is probably the main problem that people who will watch us and listen to this podcast are dealing with. But what exactly can we call insomnia? Where exactly can we start using this word?
Spoiler? We have acute and chronic insomnia. Now I'll explain in different ways how they differ, but the simplest is acute insomnia. Remember, I said the criteria for normal sleep is falling asleep in less than 15 minutes, but there's a gray area from 15 to 30 minutes. But insomnia starts when it takes us more than 30 minutes to fall asleep, so that's already a criterion for insomnia. That's a total of more than 30 minutes of awakenings during the night, or waking up early and being unable to fall back asleep for 30 minutes or more, earlier than you would like. Well, for example, your alarm is set for 7 a.m., but you wake up at 6 and can't fall back asleep after that.
It's not that I'm great, I have no money, I get up, and usually this city is already awake by then.
That's great. If someone wakes up 5 minutes before the alarm, it shows they're following a routine, so their cycles adjust and they wake up cheerfully before the alarm. And here, let me just describe the classic case of a depressive state with early awakenings. When a person sets the alarm for 7 but at 5 there's a jolt and immediately heavy thoughts start running through their mind. They start thinking in this half asleep, half drowsy state with some dark thoughts, like all cats are black at night. He keeps overthinking, lost in his thoughts, and when the alarm rings, he's already exhausted but has to get up. This is a classic example, so to speak, of stress and the development of a depressive state in this context with early awakenings and the inability to fall back asleep. And it's just shallow, restless, and unrefreshing sleep. And then there are daytime symptoms like fatigue, feeling worn out, drowsiness, low mood, and so on and so on. These are the criteria for insomnia. It can be acute. Let's say you went to bed today and didn't fall asleep for half an hour. Well, that's acute insomnia. But usually, if you don't sleep today, you'll sleep tomorrow. But if some factors keep affecting you, like ongoing stress or certain physical health problems, chronic insomnia is when you have 3 or more bad nights a week. With the criteria I mentioned, taking 30 minutes to fall asleep, waking up during the night, waking up early, and this lasts for more than 3 months. This is already a very serious situation, and usually it won't go away on its own. That means there is some serious reason that caused and is maintaining this insomnia, but here I'll say something paradoxical. I can say it's not even paradoxical. I've even talked about this somewhere before. For the first 15 years, I treated people incorrectly. We've had insomnia since 1995. I did everything for you, yes, just as I was taught. If you examine a person, do a polysomnography, and there's no apnea, no periodic limb movement syndrome, no parasomnias, and all that stuff that can happen at night, maybe you checked, a psychiatrist consulted, seems like there's no schizophrenia, right? All the hormones were tested, all the trace elements were checked, everything is normal, but the person still has insomnia. But still, back then, it was considered that this was most likely some kind of hidden psychopathology, and usually, neurologists or psychiatrists would make their own diagnosis. They would find some borderline disorder. It would then begin with antidepressants, antipsychotics, and sleeping pills. But I understood that we would never cure this patient. We stop the medication, there's a relapse again, we prescribe it, things get a bit better, we stop it, and there's another relapse. What? It turned out that if a person has some kind of triggering factor affecting them during these 3 months, it really worsens their sleep. But what does a person start doing? They start making logical mistakes when they try to fight it. The first thing, they start trying, like after being stressed, they lie down and can't fall asleep, and just a month of trying is enough. A strong reflex of fearing not being able to fall asleep will form, and the bed becomes associated with insomnia. The primary factor might go away, but this reflex will remain just like a Pavlovian reflex. By the way, in the West, this is directly called the Pavlovian model of insomnia development. Someone nears the bed and sleep vanishes. That's the first thing. Second, the bed itself becomes associated with insomnia. If you put a healthy person in bed, even if he doesn't want to sleep, he'll fall asleep in 15 minutes. But a person with a conditioned reflex of bed insomnia, even if he wants to sleep, as soon as you put him in bed, that's it, sleep disappears. Second, there's what's called negative forecasting. When a person thinks, let's say you didn't sleep one night for whatever reason, what do you think about the next night?
Probably, if I don't nap during the day, sleepiness will build up and the desire to sleep will increase. I'll probably fall asleep easily, quickly, and very deeply.
You might think you'll just catch up on sleep the next night, but how does someone with chronic insomnia see it?
That it will get even worse for him?
So, he thinks it will get even worse. He thinks it's a complete nightmare. In fact, this actually puts the person under even more stress. So the sleep disorder itself causes anxiety, stress, and depression. And next is the so-called maladaptive behavior, when a person thinks, well, I can't sleep, so I need to go to bed earlier and get up later. Just this morning, I consulted a female patient. Before her insomnia, 7.5 hours of sleep was enough for her, but now she spends 10-11 hours in bed and says, I only sleep for 2 hours. Oh, doctor, help me, I'm dying.
Before this podcast, we discussed my friend Raphael. So hello, Raphael, who says he only sleeps for 2 hours. And you said that sometimes a person thinks he sleeps for 2 hours. And there is a certain type of sleep perception disorder where in reality he is sleeping, but he is just not fully aware of it.
And these patients develop this very phenomenon of sleep perception disorder. Because the longer a person stays in bed, if 8 hours was enough for him, well, 7.5, but he stays in bed for 11. Healthy previous sleep will stretch out over all these 11 hours, and there will be even more awakenings during the night. There can be 10, 20, or even 30 of them per night, and the peculiarity of the brain is that it remembers when it's not sleeping but doesn't remember when it is that healthy sleep. The realization comes only in the morning. Now imagine if you woke up 30 times a night for a couple of minutes each time. It got dark, someone moved, a fly flew by, a door slammed, birds started singing, cars started driving, the sun began to shine. You might think that you barely slept all night, but in reality, you still got your same 7.5 hours of sleep. But their sleep was often interrupted by awakenings, and the person feels like they aren't sleeping at all. And by the way, these are the people who say, Doctor, I don't sleep at all. Back in the day, things were good. I used to sleep 8 hours and I could even take a decent half-hour nap during the day. But now I don't sleep at all at night and can't fall asleep during the day either. And soon, doctor, I'm going to die. He says, listen, you've had insomnia for 15 years already and nothing terrible has happened to you so far. And it's paradoxical that these people with such insomnia, before and during their insomnia, actually sleep exactly the same amount of time. That's what I started with. You can't cure this kind of insomnia with pills. Insomnia has its own time, and you can't force yourself to sleep more than that. But that would require mega doses of medication. And actually, you even have a little book here. May I show it? Here it is. Look, this wonderful little book is called How to Overcome Insomnia. It's a textbook on cognitive behavioral therapy. That's basically what it is. If our insomnia is related to problems with thinking and behavior, and we use techniques that change thinking and behavior, then we cure the person. Do you want me to explain these diagnoses in simple terms? By the way, how do you feel about cobras?
Yeah, I'm fine with them. Well, you?
Imagine walking a narrow path when a cobra suddenly appears, rises, and hisses with its hood spread.
Well, I'd either walk back or go in there.
What kind of feelings would you have?
Well, probably anxious ones.
You'll get closer to her. The patrol is a mess.
I'm going in.
You'll go in? Yeah, well. So, basically, there will be stress, I suppose, and the reflex will kick in. That's right, that a cobra is dangerous. Once I had a snake catcher on my show who used to catch these snakes, and he... By the way, it's interesting that the king cobra has such a variable venom that you can't develop an antidote for it. For Siamese cobras, kraits, and other venomous snakes, you can, but not for these. So basically, if it bites you, that's bad news. But if you catch it and milk it, that's $300. Well, you need to arm yourself, put on gloves, and preferably wear boots. By the way, some of these carpets also spit for a couple of meters. They don't see well, but they hear well. You distract them with sound somehow, then press them down with a stick, grab them, milk them. Well, that's how this snake catcher told you how to milk and catch them. Of course, you got scared, but you caught them, milked them, and earned about $150 each. The next day, you pursue the cobra again. You're still scared, but you mostly know what to do. You gear up, grab a stick, pin it down, milk it, and earn $300. After doing this daily for a week, 2, 3, or even a month, what will you think when another cobra passes by?
$300.
Ah, come here. This is what cognitive behavioral therapy is, and what's interesting is that behavior, being, determines consciousness. Here is the founder of cognitive behavioral therapy, Aaron Beck. He lived to be 100 years old. Until he was 50, he was a classical psychiatrist and worked within the paradigm of psychoanalysis. And he said that to change one's thinking, it takes 50 to 100 sessions and 1 to 2 years of practice. But when he started working in cognitive behavioral therapy, he said that 20 to 30 sessions over 2 to 3 months were enough to achieve the same result. And when we treat this kind of insomnia, strangely enough, we treat it by restricting sleep. We ask if 7.5 hours was enough for you, then we take away another hour, and you are allowed to stay in bed for 6 hours and 30 minutes. The person says, but how can that be? You still only sleep for 2 hours, so what's the point of lying in bed if you still only sleep for 2 hours? That's why it's 6.5. I assure you, when we actually create a sleep deficit, after a week or 2 at most, the doctor says, I'm already standing next to the bed and everything is being monitored. There's a tracker. If you don't lie down right or don't get up right, that's it. Penalty. You're fired. And talks about 12. Collapsed. That's it. Fell asleep in 5 minutes. Then I can't open my eyes. Won't get up. I have to, doctor. You'll scold me too. And then after 2 weeks, a person who hasn't slept for 20 years starts sleeping those 6.5 hours. I say, can I add 15 minutes, doctor? Thank you. It's such happiness to lie down for another 15 minutes. So, in general, a person starts to understand what true daytime sleepiness from insomnia is. They don't understand at all. It's not sleepiness for them. It's fatigue, exhaustion, but not sleepiness. But if sleepiness is created, whether there are reflexes or not, they'll manage. And it's enough to maintain this kind of sleep deficit for 3 weeks as a positive reflex. The bed association forms again. So, if before you would come to bed and there was a cobra there, well, even if you take a lot of pills, you'll fall asleep, wake up, and there will still be a cobra. But if you've learned to chase it out of the bed, that's great. Now I have patients who come to me, whom I prescribed medications to 15 years ago, and now I'm helping them get off those medications. I cure their insomnia in 6 to 8 weeks. Sometimes it's been going on for many years, even 10 or 20 years. Fascinating how medicine constantly changes.
So, personally, I hate flying. I have a fear of flying. I always want to fall asleep and sleep through the whole flight, but I can't do it. I tried not to sleep before the flight. I tried taking sleeping pills, and even when I couldn't find any, I tried taking allergy medicine during the day, as I normally would. If I take that, I'll definitely pass out in half an hour. It doesn't work. I just sit there feeling broken, and just as I start to drift off, to sink in, the plane is taking off, there are some sounds, holes, the flaps are working, I feel everything so clearly. Any changes in the sounds, it seems to me like something's about to go wrong with the plane. I'm flying and trying, I'm in a wild state, okay? It's an hour and a half or two, but recently we had a flight that lasted almost 10 hours. I spent 10 hours, we flew all night. What kind of plane do you give to people who can't sleep when you want them to? When you need to realize that, for example, you need strong sleeping pills, and you need to do something about your schedule.
Well, as for aerophobia, it really was a big problem. I had a patient who would drink half a liter of cognac every time. He said sometimes he wasn't even causing trouble there. But sometimes the plane couldn't take off because he was too drunk, so they would take him off and he would miss his flight. Sometimes he managed to get on the plane and fly, and he would sleep. But there are various psychological options, including cognitive behavioral therapy. As far as I know, we even have groups and coaches who help people overcome aerophobia using various methods. So yes, it really is possible. A calming medication or tranquilizer can be used, but it's best to consult a doctor first.
Here's my question. That's exactly the point. They're listening to us now and wondering, for those who have insomnia, how do they know it's time to come see you? There are, for example, medications that are advertised on television for sleep disorders like, take this medication. How can someone know if it's enough to just take the medication? For example, as you mentioned, zinc, melatonin, gamma-aminobutyric acid, different supplements. And by the way, here's another question. Does all this even work if there isn't a deficiency of melatonin or magnesium, for example? Does it work or not? It only helps when that's the actual cause.
So, I would say that if it's just 1 or 2 sleepless nights and you clearly understand that it's just some kind of stress, well, once the stress passes, you'll definitely sleep better. Next, take a look at your lifestyle and remember that person who drank 10 cups of coffee. After all, sometimes a patient comes to me and says, "Doctor, I have insomnia," and I start asking him questions. Well, yeah, I stopped doing sports about a year ago, got a lot more work, and I hardly walk anywhere anymore. Sidrog, 3 chairs, the car seat, the office chair, and the chair in front of the television. Well, weekends, I hardly have any weekends because I have to work. Recently, the mayor of a major city with 1 million people consulted me about depression and insomnia. I asked, "Listen, do you have any weekends?" He says, "Yes, I do." I ask, "What about your phones?" He replies, "I barely have any." I ask, "Can people call on weekends?" He says, "Yes." "Can they call at night? What topics can they call about?" Well, like if a pipe bursts, or I don't know, some kind of accident, a strike. I say, "Listen, you live in a city of 1 million people. Don't you have any special services for that?" He says, "No, they do everything." I ask, "Why do you need this?" Why do you need to know at 3 in the morning that a pipe burst if you can't do anything about it anyway? And you need to see how you live. That's another example.
Imagine you used to do bodybuilding.
You came to be a coach. You say, "I want to become a champion." You were a champion. Something like that.
You won something in jiu-jitsu.
And in jiu-jitsu, it's even cooler. Yeah, to win. A championship, maybe for the district, school, or city. The coach looked at you, assessed your condition and said, "Well, my dear friend, let's train 4 times a week for 2 hours each session. For example, and in 3 years, I have a certain method that will make you a champion," says this coach. "I don't get it. I want to lie on the beach, drink beer, eat donuts, smoke, and I want to be a jiu-jitsu champion. And I want to come to you once a month." What would the coach say to you?
Well, I think he would laugh.
And to come to the doctor and say, "Doctor, I drink 10 cups of coffee and tea. I have no physical activity at all. I'm constantly stressed. My smartphone falls out of my mouth when I try to fall asleep." I have alcohol constantly there, in some serious amounts. Well, just give me a pill that will make me a health champion.
That's what they want.
Unfortunately. And that's why the first thing I do is analyze their lifestyle and give those recommendations. Or maybe the person themselves. There's also a little book over there, Tips for Healthy Sleep, version 4.0, that helps a person think for themselves about what to do about it. Yes, there are calming medications, for example, of herbal origin. Yes, you can look into that. A deficiency of vitamins, trace elements, magnesium, or iron can cause severe insomnia, but taking them thoughtlessly isn't good either. For example, too much iron is also bad, and so is too much vitamin D. I literally just recently recorded a video about hypervitaminosis and vitamin D. The kidneys can be damaged, calcium can deposit in organs and systems, and it can even lead to coma if you take extremely high doses. So here I would say that if it's a chronic situation, it's definitely better to see a doctor. If it's acute, see what triggered it and remove the provoking factors. Try.
Nigurushi. How do they actually help with sleep? Can you use them? Or is it a disruption of some physiological sleep process and you should sleep without them, and should you use them?
Here they really help with sleep, and sleep masks too, especially now for us. In the summer months, it will start getting light at 2:30, and by 3:15 the sun will start to rise. Especially since we don't switch to daylight saving time, and obviously we don't get up at 3:30. As soon as the first rays of the sun appear, we try to block them out. If there's no blackout, the sunlight can get into your eyes and wake you up, and sleep masks are quite effective at blocking out this external light. Moreover, I'll say this, I recently read a study on smartphones. It was once thought that closing your eyes reduced light exposure by at least 10 times, sometimes even 100, so you wouldn't notice the light. But this study showed that there are some super light sensitive people who perceive light almost the same, whether their eyes are open or closed, including in particular the light from a smartphone.
By the way, sorry to interrupt. Regarding tanning beds, many people don't wear goggles when they go to a tanning bed, they just close their eyes. And there is also a study that shows your eyes are still affected, even though you are standing in the tanning bed with your eyes closed.
Well, that's basically how it is. And sometimes, even if just a roommate is looking at their smartphone in bed, these people sleep poorly. And of course, if there is some external source of light as well. As for earplugs, yes, they also help to isolate. The only thing is that they come in different types. There are foam ones, just regular foam, and there are gel ones, but both types work. When you put them in your ear, they expand and put a bit of pressure on your ear, and not everyone likes that. There are also wax ones, and when you put them in, they spread out in your ear and then don't put any pressure. Or even, strangely enough, the good old-fashioned way. Cotton wool coated with petroleum jelly provides excellent sound insulation, and people sleep just fine with it. It's actually one of the best types of earplugs, and it does a great job of blocking out external sounds, especially those that are informationally significant. If the television is on or the neighbors are talking behind the wall, it helps you fall asleep. Sometimes it just crosses into some reasonable, let's say, criteria, and a person starts creating a bunch of rituals around insomnia. So that, God forbid, no one walks around for 2 hours before, so that no lights are turned on, so that the doors are closed. The person has been in this mask for nearly half an hour, lying in bed thinking, I'll fall asleep now, using earplugs and other methods. This is already maladaptive behavior.
His name is Roman Alexandrovich. The question is about sleep. Do you ever feel sleepy in the evening? The guys are writing, at 6 or 7, I feel insanely sleepy, but I understand that if I go to sleep now, I won't be able to sleep later. Literally, if I push through for an hour or two, then I can't fall asleep at all. So what should people like this do? Should they fight this sleepiness at 6 or 7 o'clock?
As a rule, this is a situation where a person has again a conditioned reflex that has formed, he used to sleep at this time. Or it's when there's a disruption of time zones, for example, when the schedule is pretty chaotic and the body doesn't understand at all when it should be awake and when it should sleep. And in this sense, patients with insomnia are a good example. Remember when they develop a conditioned reflex of being afraid not to fall asleep. A person says, I'm desperately sleepy, it's just terrible, but as soon as I get close to the bed, it disappears. That is, just the thought that they need to go to bed causes stress in a person and makes the feeling of wanting to sleep disappear. What's interesting is that the person says, for example, at 10 in the evening I want to sleep, but when I go to bed at 11, I just can't fall asleep. and they think, let me try going to bed at 10, but when they lie down at 10, at 9 they desperately want to sleep, but at 10 that feeling disappears. If they go to bed at 9, at 8 they desperately want to sleep, but at 9 it disappears. This is how this conditioned reflex appears.
It also happens that on a weekday, when it's time to go to work, you think you'd give half your kingdom for 2 more hours of sleep, but on a day off, like Saturday or Sunday, when you don't have to go anywhere, you don't feel that way. At 6 o'clock, it's like someone stuck matches in your eyes. No, I'm not going to sleep. I need to do something more fun. So, does this happen too? Yes, really. You know, I have a question like this. Sometimes guys wake up. Well, I collected questions before our podcast, and he says, the alarm rings, I wake up, and I feel so energetic, like I had a great sleep. He thinks, well, I could actually sleep for another 50 minutes, so he lies down for 15 or maybe 30 minutes, and after 30 minutes, he wakes up. It's not like he feels even more rested. He wakes up so exhausted, as if he spent the whole night carrying bricks and didn't sleep at all. What causes this, and is it really possible?
Do you remember I mentioned that our sleep goes in cycles, and there are phases, actually not just phases but cycles, meaning the first, second and third stages. Then comes rapid eye movement sleep, followed by a slight physiological awakening. In fact, any healthy person wakes up a little after each full sleep cycle, opens their eyes, moves around a bit, falls back asleep in just a few seconds, and forgets that they even woke up. And actually, the most physiological way to wake up is after a full sleep cycle. That is, after the first, second, and third stages, then the rapid eye movement phase, and then a natural physiological awakening. It's best to get up at this time, really. I want to say that if you want to wake up feeling energetic, cheerful, and refreshed 5 minutes before your alarm goes off, just try for 2 weeks, regardless of whether it's a workday or a weekend, to get up at the same time every day. And your body will adjust its cycle to this wake-up time. That is, the rapid eye movement phase of sleep will end, and you'll wake up right at that moment, even, as I said, a few minutes before the alarm goes off. But what can happen to people, like what happens when the alarm rings? If this somehow coincided with the rapid eye movement phase of sleep, the end of the rapid eye movement phase, the person will think, oh, how great, I feel almost completely refreshed. But if he falls asleep again, and in half an hour reaches a deep stage of sleep, delta sleep, and then the alarm rings again, it's much harder to wake up from a deep stage of sleep. There may be clouded consciousness, dysphoria, or a bad mood, and the person might need 5 or 10 minutes to recover and feel completely exhausted.
Now, there are bracelets that supposedly track these sleep phases, but we won't get into that. How do they do it? Do they work or not? Just briefly, do you recommend them or do you use them?
They work in about 80% of cases for the most part. They determine when rapid eye movement sleep ends, and that's actually how smart alarms work. The device detects when the rapid eye movement phase of sleep is over, and at that moment, the alarm goes off. But here's the problem. If you need to get up at 7 a.m. and my alarm goes off at 6:30, I'll just kill that alarm. I just can't do it. And if you keep shifting your bedtime back and forth, it's unclear when the sleep phase will end. And you set a time range on the alarm, let's say from 7 o'clock to 7:30. Within that half hour, if your alarm detects the end of a rapid eye movement sleep phase, the alarm will go off. And only if it doesn't detect anything at all, it will ring at 7. So it turns out that it can ring at 7 at 6:45 or even at 7:30. If it doesn't bother you to wake up half an hour earlier, then it's great to wake up with this alarm. But for some people, myself included, this is absolutely not okay.
A question about falling asleep. I like to go to bed late, but not because I have a lot of things to do. Sometimes I just turn something on to watch or sit on my phone. Although I objectively understand that I need to sleep and go to bed, sometimes I just sit there and don't even know what I'm doing. And the question is, I don't fight sleep, I really don't feel the need to go to bed, but if I go to bed, I fall asleep right away. You still need to sleep when you feel tired, or should there be some kind of time interval? If there is one, what's the optimal time?
Well, ideally, it's best to do it 2 hours before sleep. It's best to stop using your smartphone and doing any kind of active mental work at least an hour before sleep, because your nervous system needs to calm down in order to transition from being actively awake to falling asleep. And when you're on your smartphone, especially surfing, every tap is a decision you have to make. Even when you're watching television, you're watching passively, but with a smartphone, it's always an active process. Yes, plus, a smartphone is generally perceived as a work gadget. Can you imagine that? There might be some funny ending where someone goes to bed with a hammer. Well, it's a work tool for them, and the person has already spent 5 hours on their smartphone, and now they're also watching the news. Actually, information detox is a separate, serious topic that maybe should even be discussed. But the problem is that the brain gets activated when interacting with a smartphone. Moreover, if you haven't reduced the brightness yet, that's also the blue spectrum for the brain. Remember, especially in light-sensitive people, it suppresses the production of melatonin and air. Another day arrives, you have to work, and sometimes you may not want to sleep at 1, 2, or even 3 in the morning. Only after the phone finally drops from their hand does the person fall asleep, but then they can't wake up. He keeps pushing back, delaying this falling asleep phase, shifting his circadian rhythms later and later, and then he can't wake up.
Pillow, blanket, pillowcase. What kind of bedding should be the right one? And in general, does it affect the duration? Because I saw a whole main project in the book and I became interested. What are your recommendations for our bed environment? That includes light, television, and sounds.
First, the bed should be wide, especially if 2 people are sleeping on it. Because if we have a standard double bed that starts at 140 centimeters wide and 2 people are sleeping on it, that means each person gets how much space? 70 centimeters each, the width of a standard child's bed. Yes, and next to you the person is tossing, turning, fidgeting. 180 is better, or even 2 beds side by side, yes. But it's a common misconception that it's good to sleep on a hard surface. There's nothing beneficial about it. There is a very limited group of people who, for medical reasons, need a hard surface, like a spinal injury, illness, and so on. After all, only our spine has 4 curves. If a person lies on a flat, hard surface, they only touch it at a few so-called pressure points. For example, if a person lies motionless, let's say someone paralyzed and developing bed sores, they touch the surface at just a few points. And the brain of a healthy person is constantly sending signals. I've been lying here too long. I've been lying here too long. I've been lying here too long. And a person on a hard surface wakes up much more often and tosses and turns much more frequently, and naturally, this worsens the quality of sleep. Yes, the bed shouldn't be too soft so it doesn't turn into a hammock, because then the spine will also curve and so on, and it's uncomfortable to sleep on your stomach. But even a soft one, if we have an anatomical orthopedic mattress, it keeps its shape up to a weight of 120 kg, and ideally, it's a semi-soft mattress for the average person. So that on one hand it's flat, but on the other hand, the top comfort layer follows the contours of the body. When you lie down on the mattress, you shouldn't feel any individual pressure points and you shouldn't sink in like a hammock. You know, like those old sagging spring mesh beds, right? It's terrible, reminds you of pioneer camps and work brigades. But you shouldn't feel like you're lying on a hard base either.
A friend gave it to me. He was visiting and he said, "Why are you sleeping on something so awful?"
It's just a regular mattress.
I said I'd give it as a gift, so he gave me the mattress. He said, "You definitely have to go and pick it out yourself." And I really did lie down on it. They're so unusual. They showed me, they throw a metal ball and it doesn't bounce, it kind of sticks and then it starts to sink in. And our mattress is like that too. It seems firm, but when you lie down, you start to sink into it. So it holds this memory shape, you know, this expensive orthopedic kind. And you don't really need it at all. It's just more of a marketing thing.
Listen, I wasn't always a great somnologist, and I remember sleeping on simple, regular panel mattresses. And even now, sometimes when I stay at a hotel, especially a non-chain one, even if it has 4 or 5 stars, there's just a basic mattress there. Here, to put it mildly and politely, the panel mattress is hard, and there's some kind of extra layer, like a carpet on top, so you end up hurting afterward. No, listen, it really depends a lot. Yes, of course, maybe you don't need to buy a mattress for $500,000, but a good mattress with independent springs should cost at least $1,000 per square meter, specifically for the sleeping area. Yes, or as you described, these are springless mattresses with memory foam. Most likely that's what it's called, yes, because I don't know if you can use that name or not. I have nothing to do with that, so this is what allows it to follow the contours of the body. I don't know how you sleep on it or if it's more comfortable that way.
Yeah, I seem to sleep fine.
Well, when a person is good, healthy, and young, it doesn't really matter where you put them, everything is fine. But when you get older, comfort becomes more important. And definitely, once again, on hard mattresses, sleep is more shallow, with more awakenings, compared to these semi-soft ones, medium firmness, with a normal, comfortable layer.
Tell me, what do you think about sleeping after a workout?
It depends on the workout. I also recently had a patient who, well, his workouts are like this. He's in good shape. This guy, he sets goals for himself. He decided to improve his sleep and without telling me also wanted to lose weight and start working out. He started working out actively saying, well, my sleep was bad because I worked out for 2 hours, did some lifting, and before that, I hadn't been exercising. Yeah, and then he also went to the sauna and sat in the steam room 4 times for 10 minutes each. And he says, for some reason, I didn't sleep well after that. Well, everything should be in moderation. There's a training mode, right? And then there's a mode that's not really training at all. So, you know where that comes from? The marathon distance started. He ran 42 kilometers and 195 meters. Yeah, they said he won, and then he died. So you shouldn't push yourself to the very end like that. And it's also important what kind of load you're taking on. Jiu-jitsu, after all, is a serious sport, quite demanding.
After training, I would fall asleep incredibly deeply and soundly.
How much sleep did you need to recover from them? An hour?
Probably about 3 hours.
And that's why I say that it's best to finish these kinds of workouts about 4 hours before bedtime. It's one thing if you're just taking a walk before bed. You can finish that 15 minutes before bed, but it's best to finish swimming an hour earlier. Moderate activities or just short runs are fine, but the more intense the sport, the more it requires concentration and attention. Well, for example, wrestling, boxing, tennis, rock climbing, or some kind of equestrian sport like Vladina, you should finish training 3 or 4 hours before bed in those cases.
4 training sessions from the surface. But still, you need to sleep in the dark. There shouldn't be loud music because people like to turn on music. Sleeping to the sound of rain is also, in principle, probably not something everyone should do. Temperature, as we know, in nature, things get cooler. And one of the ways to improve sleep, as I thought, is to make the temperature a little lower than usual. Thank you for watching. Aite, Roman. The person I'm lying with says they forget, and another person says they're cold, and there's a constant struggle. Opened the window, closed it, opened the window, closed the window. I wait, let's say, for him to fall asleep so I can open the window, but as soon as I open it, she wakes up and says to close it. So, what should I do in this situation?
Everyone has their own thermoregulation. Some people sleep in the summer wearing a nightgown, pajamas, a hat, and wool socks under a down blanket, while others sleep in the winter under just a sheet and naked, or even without a sheet at all. So, everyone has their own way here. Usually it's better for everyone to have their own blanket. Well, if you want it cooler, you can cover yourself with a sheet, and if your wife or your bed partner wants it warmer, then let them use a warmer blanket. Everyone has their own microclimate. So here, well, you have to find some kind of golden middle ground when it comes to general preferences. It's considered that the optimal temperature is between 18 and 22 degrees. Although, I want to say, some people like it at 24 or even 25 degrees, and some can even sleep at 17 or 16 degrees. So again, there isn't really a universal standard that works for everyone. If people have very different temperature preferences, yes, that can be a problem. It's just like how a night owl and an early bird sometimes can't get along. The night owl wants to go out, while their neighbor or partner is already going to bed at 9 post meridium. The night owl is just getting interested in something, and the partner is already up and off to exercise. So there's a bit of a problem here.
Roman Vyacheslavovic, I need some advice. Sometimes in the evening, I prepare a presentation for a speech the next day. How can I sleep more effectively? Let's say, I don't even know how to put it correctly, so that what I was working on would be as effective as possible, but it would stay with me, and in the morning I wouldn't have that feeling of an empty head. It probably depends, like there are these life hacks.
Well, a life hack, I think, the more presentations you do, the better it will get. It's like public speaking, Approximately, the first time I spoke publicly, I think it was sometime in the 90s, if I'm not mistaken. It was 1998. Yes, it was still Andrei Malakov. He was hosting the show Nazdorovia on Russian television and radio, and it turned out to be a live broadcast for half an hour, and it was just terrible, I remember. I was sweating all over, but now I come there. They ask, "Are you nervous?" I say, "No." "Why?" I say, "Listen, what about the questions?" You said you didn't need questions, and I replied that I'd already answered everyone. So, if you reach a certain level of professionalism, I think you've already reached it, then everything just goes smoothly.
In ancient Rus, there was, well, not exactly was, but how should I put it? It is believed that commoners slept lying down, while noble individuals slept in a semi-sitting position. What do you think about this theory, and how do you feel about sleeping while sitting in general? Because sleep is usually a horizontal position, but some people like to fall asleep in a chair.
You said that absolutely right. It was believed that if you really lay down and stretched out, there was a higher chance of dying. And I always like to remember the Fontainebleau Castle, where many French kings stayed. There were many bedrooms there, with different beds belonging to different kings, including even Emperor Napoleon. And all of them are semi-sitting, meaning the beds are short, so it's simply impossible to stretch out there, even if you really wanted to. And in this sense, yes, well, that's the tradition. I don't even know how it came to be, since there were many things in our world that later turned out not to be true. But I want to say that there really are illnesses where a semi-sitting position can save you. For example, sleep apnea. If a person is lying on their back and falls asleep like this, leaning back, there's a higher chance that the tongue will fall back and sleep apnea will occur. And we teach the person not to sleep on their back. For example, the person sleeps on their side or with their head elevated. In this sense, yes, there is some truth to that.
Let me ask a question. I'm not trying to be clever. This is the first time I've read about and heard on our podcast about Ivan Pigarev's visceral theory of sleep. What do you think about it? And briefly, if you know.
Yes, I know about it. I said that I've already answered all these questions in detail. I was fortunate enough to know him personally and to listen to many of his lectures. Unfortunately, he died at the age of 80. He was riding a bicycle when someone on a scooter crashed into him. He fell and suffered a head injury. It's a sad story. Yes, this is exactly what we were talking about. We thought it was a mosquito. It turned out he proved that certain sleep centers interact with the environment during the day. They start, for example, monitoring the intestines. So if you take a cat's intestine and stimulate it during the day, it won't react in any way. But it doesn't really monitor what's happening in the intestines, but if you stimulate it at night, then it's interrupted. The color of the brain will start to react to this, meaning you can see that there is a stronger connection with this part of the intestine at night than during the day. So this just emphasizes the fact that certain areas of the brain start to be responsible for certain internal organs and coordinate, adjust their function and restore normal operation. This is the visceral theory that the brain, one way or another, interacts more actively with the body at night than with the outside world.
There are even studies that show people are more likely to develop cancer. Cancer can occur if we are chronically sleep deprived. Chronic insomnia, tell me, what advice would you give to a person? Well, if they've come to see you, of course you'll examine them personally, consult, select treatment, and identify the cause. But maybe there are some ways to deal with insomnia using what's at hand?
And can you just say 1, 2, 3, like the first thing, maybe as a kind of summary of what we've talked about? Yes. First, keep your routine on weekends. Don't oversleep. Don't wake up more than 2 hours later than usual, so you don't get social jet lag. Second, don't consume caffeine-containing products 8 hours before sleep, especially if you have trouble falling asleep. Third, do regular, moderate, and high-intensity physical activity at least 4 days a week. Actually, a huge meta-review came out recently, about 1,000 studies, which showed that this kind of serious physical activity is quite enough. It is more effective than psychotherapy and pharmacotherapy in treating anxiety, depression, and accordingly insomnia, which often comes from anxiety. The next thing is an information detox. When patients come to see me, I always ask them to show me their screen time. Actually, I first ask, do you use your smartphone professionally very often? Well, if they say 3 or 4 hours, they're actually on their smartphone for 5 or 6. It's usually at least 1.5 times more. There are studies that show, for example, an average office worker, if they look at their smartphone during breaks, the level of stress at best doesn't change, and at worst it increases compared to regular work without distractions. So, a person is constantly under stress. It wasn't idiots who came up with school breaks, lunch breaks, or 5 o'clock tea. Those are times for us to relax. Some people, if I may say so without medical terms. By the way, do you know what a muffleman is? There are actually studies that show they enjoy life and have more fun than Christians. So why do they pray 5 times a day? It's actually a great relaxation technique. They get out of a state of tension and relax. And by the way, in my insomnia treatment program, I have people do certain relaxation techniques 5 times a day for 5 to 10 minutes each. And the next one could also be, a relaxation technique. So, regarding detox, as we mentioned, at least an hour before sleep, you should completely put away gadgets so your brain can calm down and you can fall asleep more easily. So, it may seem like these are completely inconvenient, trivial things, but they're very effective. In 50% of cases, you can significantly improve sleep quality and even overcome insomnia. Without any pills, without any medical procedures, just if a person manages to establish a more or less healthy lifestyle.
If you use gadgets. Gamba, melatonin, 5-hydroxytryptophan, 5-hydroxytryptophan, vitamin D, mamin.
But again, you need to check iron, for example, so we always check iron and calcium too.
But all of this mostly works in the depot, only if there is adipate in it.
Yes, well, let's put it this way. If you look at it, of course, everyone wants to take something themselves, but let's come down to earth. Yes, no one will just go to the doctor and say, "Doctor, what vitamins should I take?" Now, regarding vitamin D, there are a lot of studies showing that more than half of the adult population is deficient in vitamin D. So basically, excuse me, but almost everywhere you look, and please don't point fingers at anyone. And among the elderly, 75% have a melatonin deficiency. When it comes to magnesium, it's the same situation. So, we have research showing that in the 19th century, the average American consumed 400 mg of magnesium with food, but in the 20th century, it was already down to 200. So in some states, they even add magnesium to the water by law, and still it's not enough. As for melatonin, I think it's quite similar. Is it possible to try 5-hydroxytryptophan in this case? If it helps, it's a safe enough thing, meaning you can't really overdose on it. But if you feel better, then thank God. In general, I should add that there are always disclaimers. There may be contraindications, so consult your doctor. But if you just stay in the position of a normal, ordinary person and not in the position of some high-level doctor, yes, some vitamin complexes, especially in autumn and spring, can definitely be taken in preventive doses. First, when someone says, "I'm sad," I respond, "Okay, let's not get carried away." We have the Epworth scale, a special medical scale that determines under what circumstances a person might doze off or fall asleep. And often patients with depression say, "Oh, I'm sad." I ask, "Did you sit at the computer and fall asleep? Did you sit in a meeting and fall asleep? Did you sit behind the wheel and fall asleep?" "No, I can't sleep during the day at all." That's not sadness, that's fatigue and exhaustion. The point is that a person should actually doze off or fall asleep. Well, then there's a gradation, just in a calm environment after lunch. Well, even a healthy person might experience that. And then it gets stronger, by the television at the theater, during a conversation. Yes, that's drowsiness. That's when my patients, I restrict their sleep, for example. I sometimes restrict it drastically, especially with strong negative reflexes. The person becomes drowsy during consultations, often in the evening, while I'm talking to him. "Ivan Ivanovich, don't fall asleep." I ask if he now understands daytime drowsiness. He says he does.
Sometimes we're driving, and we can't sleep because we still have a certain distance to cover. But because of this, an accident can happen, like, for example, you accidentally end up in Kiev. Modern cars, they even show a coffee cup. Have a drink, you're tired, take a rest. Sometimes there's an issue. I need to drive for an hour, but if I drink coffee or an energy drink now, I won't be able to sleep later. What would you suggest doing in this situation? Well, obviously, Liva, one option is to stop and sleep in the car, but what else could you recommend?
You know what? I'll say that up to half of all traffic accidents related to falling asleep at the wheel happen in the last 20% of a long drive. So a person thinks, well, here it is. The long drive is almost over, just 15 minutes left. I can relax now.
And then they fall asleep.
That's exactly when disasters happen. If you feel sleepy, stop and take a nap. It's okay. You'll arrive 10 minutes later because otherwise you might not arrive at all. What should you do before a trip? Just simply get enough sleep. That's what I can say. So, if you basically have a long road ahead and you start feeling drowsy, actually that's an interesting rule. Just stop and take a nap. But what does a person usually do? He stops, takes a nap, then drinks a cup of tea or coffee, and then drives on like that.
But is that wrong?
The thing is, when a person wakes up after sleeping, he still has some residual drowsiness, and if he drinks a cup of coffee or tea, especially if it's sweetened, caffeine will start to work in 20-30 minutes, but sugar will cause an immediate release of glycogen, and it will also trigger the release of opioid peptides, your own, which actually increase drowsiness even more. And sometimes it happens that a person stops, takes a nap, drinks a cup of coffee, sits down, and falls asleep again after 10 minutes. That's why what you need to do is stop, drink a cup of tea or coffee, and then go to sleep in 20-30 minutes. The caffeine you just drank will kick in, and you'll wake up much more refreshed and ready to go.
Interestingly, when it comes to morning erections, we know that in most men, a healthy hormonal system is shown by having morning and even nighttime erections, which can be measured with a device like the Regiskin. If a person lacks daytime erections, we can measure them, including erection pulses. Sometimes a man claims he never has erections, even at night, but it's found he occasionally does during sleep. That is, when the mind switches off, the psychological factor affecting erections disappears. And even on the chart, where we can see the duration of the erection, we can see its quality. And that's important too, because we understand that technically, physiologically, he is capable of a good erection, and it's easier for him when he realizes that he can. And that the real reason here is to accept this problem and work on it. That's it. And you know what the issue is? Often, even when we've seemingly sorted everything out, patients say there are no morning erections, so that means it's all over. But why is it so crucial for you to have them? I try to explain this to them, and even run such tests. I tell them to try waking up on weekends without an alarm, and when they wake up naturally, when the body decides it's time to get up, buddy, they have an erection. But as soon as they start getting up on weekdays, boom, no erection. So could it be that the absence of morning erections is just a feature of that particular phase, like when he wakes up, and not a hormone problem?
Right, but erections happen during rapid eye movement sleep, right? So if a person wakes up, usually they wake up either during rapid eye movement sleep or at the end of rapid eye movement sleep, especially if their schedule is more or less stable. And in general, remember I said that if you go to bed and wake up at the same time for 2 weeks, your body will adjust your circadian rhythms to that wake-up time. And the rapid eye movement phase will end right before you wake up with a wonderful erection. But what if someone has a schedule where they go to bed at midnight, then at 8 post-meridium, then at 1 ante-meridium, then at 8 post-meridium again? The body doesn't understand when each phase happens, and if a person wakes up not during the rapid eye movement phase, there might not be any erection at all. So it's important to establish a proper sleep schedule. That matters in this situation too. Maybe you could give this advice. Tell this person to just wake up at the same time every day for 2 weeks, and his rapid eye movement sleep phase will adjust to this wake-up time, and most likely he'll start having nocturnal erections. That's an interesting little life hack. Question.
There's a claim that the higher up a person sleeps, the floor they're sleeping on, the lighter their sleep is, and these people tend to have more sleep problems. That's more of a myth, really. If you live on the 40th floor, it doesn't mean you'll sleep worse than if you live in a one-story house on the first floor, like in a village such as Klubushka.
Honestly, I haven't come across any scientific data on this topic. In fact, I've seen the opposite. If we mean the city, a small house like in a village is one thing, but what about a first-floor place in the city? And it's right next to a busy highway with lots of different emissions. Exhaust fumes. Yes, a person sleeps much worse because the atmosphere is bad, and so on and so forth. And in this sense, by the way, these exhaust fumes. Cars usually don't send exhaust above the 10th floor.
They're heavy after all.
As a rule, groceries and such are closer to, the air above the 10th floor is much cleaner and the amount is less. That's why I actually think there's a better chance you'll sleep better if you're higher up, especially in a big city.
Well, probably. The final question is about medical drugs that people, including self-prescribed ones, use to treat insomnia. I would like to hear from you the message that this is really a serious and significant problem. Because, believe me, many people, even my colleagues, don't know what somnology is. And really, I think this is not a joke, not child's play. This is a very serious disorder, and that's the first thing. I would like you to confirm or refute that. And of course, secondly, explain why you shouldn't prescribe sleeping medications for yourself. There, regarding dependence on them, about the fact that we're not treating the cause but just suppressing the symptoms, I would like to hear your thoughts on that. It's a kind of moral lesson. A message? Yes, guys.
And I always, love analogies. So, if you have a fever, like 38 degrees, I'm not even talking about COVID. Let's say there's no COVID, right? But when the doctor comes and you have a temperature of 38 for 3 days, well, someone might say, drink some water, maybe take some vitamins, have some tea with lemon and jam, and most likely it'll go away. There's a good saying that if you treat a cold, it'll last a week, and if you treat it, and in this sense, it's a self-limiting situation if there's an obvious provoking factor. A person says, yes, I drank 3 cups of coffee at night and couldn't sleep, or I argued with my wife and couldn't sleep after. Well, in this case, even the person themselves understands that they can use, a small dose of alcohol as a tranquilizer. In the end, even if they've taken some sleeping pills before and those helped, well, it's not a big deal. Nothing terrible will happen. Well, imagine you go to the doctor and say, Doctor, I've had a temperature of 38 degrees for 3 months. What will the doctor do? He'll just prescribe an antipyretic. Well, that means it's the kind of temperature that will soon finish you off. Tuberculosis, an abscess, a tumor, and so on. So, if insomnia lasts for more than 3 months, that's not a very good situation. That's a very serious situation. That means there are some causes that will keep it going constantly, and just using sleeping pills situationally won't be enough anymore, and taking sleeping pills for a long time, like a month, is required. This is psychological dependence, and you will be afraid to fall asleep without a pill for several months, especially if these are tranquilizers, which cause physical dependence. And a person comes to me after 3-4 years of this kind of insomnia, taking 5 medications and says, I don't sleep at all. So, he has basically become a medication addict, and we still haven't solved anything. But the person actually has restless leg syndrome, which should be treated not with sleeping pills at all, and the person has iron deficiency anemia, which causes severe insomnia, and sleeping pills have nothing to do with it here. Or the person has sleep apnea. Every sleeping pill clearly states that sleep apnea is a contraindication, because giving a sleeping pill in this case could kill the person. The person isn't breathing, and they're taking medication. Thankfully, I don't prescribe it. They do. Or did the doctor not think it through? Sleeping pills suppress brain activity, relax the respiratory muscles, and the person stops breathing more often, and the pauses last longer, making things worse. Yes, we can make sleep apnea worse and actually kill a person. The person will stop breathing and die. Pranal right now.
When
we're telling
2 interesting things were mentioned, coronavirus and sleep. Actually, I had a question. Is there a connection with coronavirus? Does it affect sleep? Since a person has had it, can it disrupt sleep?
Actually, it's an interesting situation. I like one study, though I don't remember where it's from. Well, naturally, this study took one region in a country, and in that region, there were 2 groups of people, those who had coronavirus and those who didn't. So, among those who had coronavirus, 62% of patients had sleep disorders, if I remember correctly, and among those who didn't have coronavirus, 67% had sleep disorders. In fact, I've had patients who said, Doctor, I had severe insomnia. Amid all this horror, with everyone fearing death, after having coronavirus, my insomnia vanished because now I have immunity and won't die. So, for anxious people, this whole situation that was weighing on them was causing insomnia by itself. And yes, there are studies that say that coronavirus somehow affects the sleep centers, but it hasn't been proven yet. The first thing is a disruption of routine. People, especially those who started working remotely, stopped following a sleep schedule and getting up at the same time. They started consuming more caffeine and alcohol, and their physical activity decreased. So these are various behavioral factors that made insomnia even worse, plus the total stress, which really does cause insomnia. It turns out that the significance of these coronavirus-related factors was greater than the significance of the coronavirus itself. The second one is less, of course, but it's also a significant situation, so-called post-traumatic stress disorder. Imagine, a person is admitted with coronavirus, or rather, when people just started getting sick with coronavirus, when someone was told they had been diagnosed with coronavirus, there are studies about this. For them, it was as stressful as being told they had a heart attack, stroke, or tumor. I think that I might die, and especially, of course, anxious people immediately started suffering from insomnia. Imagine they put someone in the hospital and their neighbor died in the intensive care unit, or they stayed in the intensive care unit themselves, surrounded by constantly changing patients on ventilators. Well, that's just an extremely heavy psychological stress, and then, even when the person leaves the hospital, flashbacks and panic attacks start. Well, he wakes up in a sweat and remembers that miserable intensive care unit where everyone was lying on ventilators. So this is classic post-traumatic stress disorder. At that point, psychologists, psychiatrists, and psychotherapists are responsible for treating this condition. Generally, it's not the coronavirus itself, but everything that came with it that caused the disorder.
And restless legs.
Oh, listen, that's honestly my sorrow, with all the fiery medicine and so on. Remember, we said that they don't teach sapology in medical institutes. It might seem like such a funny diagnosis, restless leg syndrome, let's all have a laugh, but I have patients coming to me with suicidal tendencies because of it. A person experiences extremely unpleasant but hard to describe sensations in their legs before sleep, which force them to move their legs. So they move their legs, it goes away, but as soon as they try to fall asleep, after 5-10 seconds, maybe half a minute, they have to move again, they wake up again, move their legs, and it goes away again. And a person can spend 2, 3, 4 hours like this, trying to fall asleep, unable to do so because they constantly need to move. Even after falling asleep, their legs twitch every minute, waking their brains so they feel like they aren't sleeping. When they see a doctor, especially a psychiatrist, they may say, "Doctor, I can't sleep," and worry they're going crazy. I remember one elderly lady, it was just like a thriller. She started having symptoms around the time she got her period because her iron levels dropped, and that's one of the factors that triggers restless leg syndrome. She was 14 years old. It was 1944, I remember, and we made the diagnosis in 2008. Just think about it, she was almost in her 80s. When she was admitted, they tried everything. She had her veins removed, got joint injections, took radon baths, saw a psychiatrist, and she complained that there was some worms crawling under her skin. Oh, that's a tactile hallucination. Let's prescribe antipsychotics, and with antipsychotics and antidepressants, they're in the same class. The effect is a worsening of restless leg syndrome because the problem isn't with the legs, it's a dopamine disorder in the brain, a so-called extrapyramidal disorder. And antidepressants and antipsychotics make extrapyramidal disorders worse. Grandma says, "Yes, I can't even stay here with you," but no, they say, "Let's increase the dose even more. Come on, Grandma." In general, it's just a nightmare. And the most important thing, which is both good and sad, is that we have very effective medications. This old lady, we're diagnosing her. She couldn't lie down in bed for 4 hours. Then she finally fell asleep, almost across the bed, constantly twitching all over. And the next day, we give her a medication that stimulates dopamine receptors, and she sleeps just fine. I come in the morning, she saw me, poor thing, she's crying, says, "Doctor, I've lost most of my life. This is the first time in over 60 years that I've slept well." And the first dose fixed everything. Sometimes you feel like, some kind of demigod. Well, it happens, but it's not because of the doctor's knowledge, it's just that there are such diseases.
Well, I hope today's podcast will, first of all, fill in the gaps in understanding for many of our subscribers, because my audience is very curious and very grateful. I think the guys will write a lot of things in the comments under this podcast. I want to thank you personally for finding time in your busy schedule and for also doing educational work. And by doing so, I believe you are giving a huge amount of knowledge that truly saves lives and brings light to society. Thank you very much.
Oh, thank you. That really lifted my spirits, and I even got goosebumps. Thank you.